pagbago. Obra kang mapisan, dengganan nga tao, iririmaw sa kakuswagan Antikenyo. O Antike, Antikenyo, buktaw bangon kagdalagan, sulong sa pagbago. Obra kang mapisan, dengganan nga tao, Antikenyo, ikaw
Sound check, voice check, mic check, check.
Before the PNA Region 6 Summer Conference 2021 begins, here are the following announcements. Participants' microphones are muted by default during the entire conference. If you have questions about the topics, please type in the Q&A box located at the bottom of Zoom's interface. Questions collated by the moderator will be asked after the lecture. Kindly use the chat box to type your comments, and for better viewing experience, hit the standard view in Zoom. Thank you very much.
Ladies and gentlemen, good morning and welcome to the second day of the 2021 PNA Region 6 Summer Conference hosted by PNA and ICE via Zoom webinar. This year's theme for its resource is Nurses, a Voice to Lead, a Vision for Future Healthcare. In 2021, we seek to show how nursing will look into the future, as well how the profession will transform the stage of healthcare. Ladies and gentlemen, this conference is accredited for 8 CPD units. If you are registered and is watching via Facebook Live, kindly log in the Zoom webinar link that was sent in your email to monitor your attendance. The link for the evaluation will be sent in your registered email after the conference today. Please refrain from sharing the evaluation link, and the official attendance will be forwarded to the Professional Regulations Commission for reference of your participation. To officially begin today's conference, Let us all invoke the intercession of our Almighty God through a doxology to be followed by the singing of the PNA hymn. Once again, ladies and gentlemen, good morning and welcome to the second day of Philippine Nurses Association Region 6 Summer Conference 2021. And we would like to greet our 409 participants via Zoom webinar and also those who are watching via Facebook Live. And as of now, we have 71 viewers. Once again, good morning. Please also allow me to greet the different chapter officers coming from the Western Visayas Regional Council. Starting off with our first chapter, we would like to greet PNA Aklan chapter officers as well as PNA Aklan members, of course headed by Ma'am Loida M. Enero, the chapter president for Aklan. Good morning. Next, we have our officers from PNA Capiz chapter. No, good morning, PNA Capiz, headed by Dr. Ronel O. Flores. Good morning, Sir Ronel, and good morning to all of our PNA Capiz chapter officers and all participants coming from Capiz. Next in line, we have PNA Iloilo chapter officers, headed of course by the chapter president, Dr. Rosana Grace Belo de la Riarte. Good morning, PNA Iloilo, as well as the members of PNA Iloilo, the biggest in Region 6. Next in line, we have PNA Negros Occidental chapters, headed of course by Ma'am Bethel Basina, their chapter president. Again, good morning to all the members of PNA coming from Negros Occidental. And of course, the host for this year's summer conference is PNA Antique chapter. So good morning to PNA Antique chapter officers, of course headed by our president, Mr. Aris Kendall R. Bungabo. Again, PNA is the host for Summer Conference 2021 Region 6, and of course, our PNA Region 6 Council officers, headed of course by our Governor, Leah P. Alayo. Dr. Leah, good morning everyone, and again, welcome to the second day of the Philippine Nurses Association Region 6 Council Summer Conference 2021. And we had a fruitful discussion for the first day of our summer conference. Yesterday, we had our keynote address given, of course, by Professor Violeta Lopez, the president of Filipino Nursing Diaspora Network, a chair professor of the School of Nursing in Hubei University of Medicine in China. Her keynote address was Nurses, a Voice to Lead, a Vision for Future Healthcare. She described how nursing will look into the future, as well how the profession will transform the next stage of healthcare. In our first plenary session, we listened to Dr. Annabel R. Borromeo. Dr. ARB is the director of the Center for Nurse Impact and Patient Outcomes Action Lab, HTAC Core Committee member and Citizens Representative. Her topic was Nursing in the 21st Century Health Systems. Dr. ARB outlined the role and contributions of nurses to deliver priority health interventions, achieving universal health interventions, achieving universal health coverage, addressing health emergencies, and increasing health and well-being for all. And in our second plenary session, we listened to Dr. Mr. Melbert B. Reyes, the National President of the Philippine Nurses Association. His topic was advocacy, a professional responsibility for nurses, where he proposed different strategies to prepare nurses to act as advocates for the nursing profession. And I hope by now we are all ready for the second day of PNA Summer Conference 2021. Before we officially begin, let us listen to a video message given no other than by the Honorable Governor of the Province of Antique, a nurse by profession and a champion for quality and accessible healthcare in the province of Antique. Ladies and gentlemen, let us all listen to Honorable Governor Prodora J. Cadiao.
Good morning, our dear nurses. Let me open this message directly by saying thank you to all of you. We wholeheartedly appreciate your bravery and we value the sacrifices you made for every one of us, especially the sick and affected at this time of the pandemic. Thank you for all of your efforts and service during this health crisis. Without you, I can't imagine how our battle against COVID-19 pandemic will be. From being in the front lines of taking care of our COVID-19 patients and risking your lives, up to giving us now the vaccine to serve as our protection from this very infectious disease. Your compassion and dedication are remarkable, and I'm proud to be one of you. Years may have passed after I left the profession, but I remained a nurse at heart, sharing the same passion to serve and to provide the best possible care to the public. I know you are all tired and overworked, but I would like to let you know that what you are doing right now is something that will be treasured not just today, but also for the many more generations to come. You are now making history by being part of the frontline heroes fighting and protecting the world against this invisible enemy. Thank you again for not giving up and for giving your best every day in your chosen profession. Very soon, this pandemic will be over and we will be back into our normal lives again. So I hope you continue to fight for us, be strong, and remain healthy for us. Know that we, the billions of Filipino and the hundreds of Antiqueños, are always praying for your safety so you can be home with your families who also need you now. We are more than thankful that in this part of history, we encountered nurses like you, our heroes, saviors, and inspiration at this time of a pandemic. Again, to our nurses, durug-durugid nga salamat, mabuhay kayong lahat, mabuhay ang mga nurses sa buong mundo.
There you had it, ladies and gentlemen. Virtual applause, please, for the hardworking Lady Governor of the province of Antique, Honorable Rodora J. Cadiao, a champion for nurses and healthcare in the province of Antique. And we are now ready for our third plenary session. And first, please allow me to introduce our speaker. Our speaker is the current Deputy Executive Director for Nursing Services of the National Kidney and Transplant Institute, or NKTI, and the founding president of the Urologic Nurses Association of the Philippines, or UroNAP. Was awarded by the Filipino Women's Network as one of the most influential Filipino women in the world. To discuss ways on how nurses can lead and provide quality care in uncertain times, our plenary session number 3 is Effective Nurse Leadership in Times of Crisis, to be given by Dr. Nerissa Mendoza Jerial. Ladies and gentlemen, virtual applause please for our plenary speaker. Dr. Jerial, the virtual floor is yours.
Hello, can you hear me? Hello.
Yes, Dr. Jerial, loud and clear. Please go ahead.
Okay, thank you very much. Thank you very much, Dr. Martinez. Hello, pwede pa share ng screen pala first?
Yes, Dr. Jerial, our moderator will now share.
Okay, thank you. Okay, thank you very much, Mr. Jofred Martinez, for that kind introduction. A pleasant morning to everyone. Well, first of all, I would like to thank Governor Leia Alayon, the officer of, hello? Wala pong share screen. I cannot see my slides. Okay.
Yes, Dr. Jerial, your screen is already presented.
Yeah. So first of all, once again, I would like to thank Governor Leia Alayon, the officers of PNA Region 6 of the Western Visayas, and the host for this conference, PNA Antique Chapter, with its president, Mr. Aris Kendall Bongabong. Thank you for inviting me to speak on the topic of effective nursing leadership in times of crisis. Well, sometime last year, I gave a lecture at PNA Cordillera Administrative Region because I was invited by our former PNA president, Dr. Castor Palaganas. And my lecture was about leadership in the time of pandemic. So Governor Leah mentioned to me that she also attended the said conference, and she said she liked it. That is why she asked me if I can give a lecture with the PNA Region 6. Well, I incorporated some of my some of my slides before in this lecture, and of course I added new slides that is fitting in our current situation. So before I start with my lecture, please focus and watch this video about how to stay motivated, how to be inspired, and how to lead. Well, that is one of my favorite motivational videos about leadership. I included that video to this presentation because I know that you will learn something from it. So, up to this time, I still get motivated every time I will watch that video. Well, the message in that video is telling us that all of us have the potential to be a leader. All of us have an inner spirit of a lion waiting to be unleashed. So when you talk about leadership, what really comes to your mind? Um, is it the position? Or can anybody in your organization or your unit or anybody in the community or anybody in the household can exercise his own leadership? So what does leadership mean? An American author, Warren Bennis, stated that leadership is the capacity to translate vision into reality. So it means that leader has the power to transform what you see for the future in reality. Bill Gates, one of the richest men in the world, also once said, as we look ahead into the next century, leaders will be those who empower others. So, leadership is also about empowering others to do better. And of course, my favorite, John Maxwell, believed that leadership is influence, nothing more, nothing less. So, leadership is really about influence. It's how you influence others. To sum it all, we can say that leadership is a process of social influence which maximizes the efforts of others towards the achievement of a goal. It brings about people towards a common goal. So let's first discuss about the 360-degree leadership before we dive head on to alleviating the pandemic through empowering leadership. So have you ever heard about 360-degree leadership? So what does 360-degree leadership mean? And what does it entail? Well, when you talk about leadership, the reality is 99% of all leadership occurs not from the top, but from the middle of the organization. So only 360-degree leaders influence people at every level of the organization. Well, for me, this is very true because there is only one top dog in an organization, in a unit, in a department, or in a division. There's only one head, right? And that person cannot stay there forever. So he has his own time or term to serve. So in a few years, maybe I will retire, and so as the others. That is why, as early as possible, leaders should already start identifying his successors from the middle of the organization. So you really need to identify staff with great potential, staff who are efficient, staff who are dedicated, passionate, somebody who is innovative, has a heart for continuous quality improvement, and committed to the job. Well, perhaps now your leaders are probably identifying some of you already to be the future leaders. Well, I personally believe that there are many talents from the middle of the organization. All you need to do is just to train them, coach them, and of course, mentor them. Leadership is the choice that you make and not the place you sit. And as I've said a while ago, leadership is influence. It is how you influence people to do the right thing and, of course, the significant thing. This is a 360-degree leader. As I've said, even if you don't have the position, you can be a leader in your own way. Even if you are in the middle of the organization, if people believe in you, if people trust you, and if this you have the, should I say, the knowledge, the skills, and the right attitude, you can definitely influence others. People will listen to you, and even the senior leaders in your organization will listen to you. So who are the senior leaders? It could be your medical director or your executive director, your manager, your chief nurse, or your supervisor or head nurse. Well, the peers are your senior and junior nurses, the medical services technicians in our unit, the aides, the clerks, and even other members of the healthcare team, like our doctors, the the med techs, the pharmacists, the dietitians, the social worker, the admitting staff, and other administrative staff. And our internal and our external others are your clients, your suppliers, and of course, our contract of service, if you have that, if you have a job order, or our outsourced staff. We also have our direct reports, and those are the people who you manage in your areas. So, as a 360-degree leader in the nursing practice, that is a person who develops others and leads from any position with an organization by leading up, leading across, and leading down. Well, so what is the value of 360-degree leaders in the nursing practice? Well, a team of leaders is more effective than just one leader, right? So leading well in one role prepares one to be a better leader in other roles. And strong leaders in the middle make better leadership at the top. If we all start practicing 360-degree leadership, wherein we all collaborate, we all cooperate, help and support each other, then we will be able to maximize our potential in leadership. Whatever position you hold right now, whether you are a head or you are a staff, it will serve as a fertile ground where you can start to grow personally and professionally. And as nurses, we need to develop the head, the hand, and the heart approach. The hands perform their job duties because they are told to. The heads perform their duties because they know that they are supposed to. The heart perform their duties because they want to, because of their love for their job and those for whom they are performing their services. Most leaders are not all head, hands, or heart. Most are some combination. But even leaders who have all three is in seemingly equal measures have some pitfalls also to watch out for. But because we are not perfect and nobody's perfect, we all know that. The point is not to change who we are fundamentally, but rather to embrace our strengths, shore up our blind spots, and adapt our styles to be more effective when leading across a variety of different people and different situations. So, as nurses, we have to use our hands, our head, and our heart to better serve our patients, of course, with tender, loving care. So, what are the foundational principles of leadership? Well, according to John Maxwell, everything rises and falls on leadership. Leadership must be close enough to relate to others, but far enough ahead to motivate them. He who says he leads but no one follows is only taking a walk. Yes, for me, this is very true because as a leader, your people are expecting excellent leaders from you, not just for the success of your organization, but also for the welfare of your staff. For example, if your leader is good in decision making, she's good in conflict management and in problem solving, has concern for people, and recognizes their effort. They are involved in continuous quality improvement studies and research, has good plans and strategies to continuously improve the systems and procedures in the nursing services, then definitely the nursing services department and any unit under that will go far. It is also imperative to invest in developing yourself as a leader, to continue to make your personal growth as a priority. So how can you do this? By taking master's degree. You can also take a PhD, although it is not a requirement. By attending also conventions, seminars, or webinars for updates. And you should also, for me, you should also study. You can inject new ideas and many innovations, or even implement projects and programs in your area. So, in other words, you should be a role model to influence others. But if you are lax, always delegating without being involved, no innovations, no improvement, just doing the routine thing, then you can never be noticed and you cannot expect to produce great results. Well, there are 5 levels of leadership that I want to share with you: the personhood, people development, production, permission, and position. So I will discuss this to you one by one. First is position. People follow because they have to. Well, this focuses on hierarchy. People follow because of your position. For example, if you give an assignment to your staff and you gave a deadline, the staff will have to comply because he respects the position and because of the need to get it done. But if you will always use your position as means of controlling everything in your department, division, or section, then expect high turnover and lower morale from your staff. Next is permission. People follow because they want to. This focuses on relationships. If you have established a good relationship with your people, leading will be easier because they will start to offer their services to you because they want to help. For example, in the operating room, your staff will tell you, Mom, I'm already done assisting with all the operations assigned to me. Is there anything that you want me to do? Or how can I be of help to you? So in this stage, there is an initiative already. The staff is offering his service voluntarily. So in here, people will follow you beyond your stated authority because they look up to you and this allows work to be fun. Another is production. People follow because of what you have done for the organization. This focuses on results. This is where success is sensed by most people. They like you as a leader and they like what you are doing. You are now starting to build influence. You are already inspiring people. For example, if you were given the task to head a committee by your boss and you're looking for members who could help you. So when you invite people to join you, these people will readily say yes to you because they believe in you and because of your credibility to produce outstanding outcomes. Next is people follow, I mean, the people development. People follow because of what you have done for them. This focuses on reproduction. People follow because they are happy with your performance as a leader and they are already empowered. The concern and love that you show to your people goes beyond what is expected. And because of this, the people will feel that they are important to the organization and you value their existence. They want to feel that you are always there for them, especially in times of need. Then next is personhood. People follow because of who you are and what you represent. People follow because of respect. They believe in you and they know that they are in good hands. People are now proud to be part of your prestigious organization. They would say that I am proud to be a frontliner of Western Visayas Medical Center. And I am proud to be under the leadership of Dr. Leia Alayon. So this step is reserved for leaders who have spent years growing people and organizations. Well, few make it, but those who do are bigger than life. Here are some of myths in leadership that are the most common misconception of people. Um, there is also what we call the influence. Wait, first is the destination myth. When I get to the top, then I will learn to lead. When well, I would like to ask you, is this true? Well, for me, no. To be a good leader is not automatic. You learn from, of course, you learn from your mentors, you learn from books, through conventions and webinars, through experiences, and of course, through others. Through your colleagues, you will also learn from them. So we should know that leadership is not just a position, it is a process. There is also what we call the influence myth. If I were on the top, then people will follow me. People will follow me or people will follow you because of the position. But of course, You should show and prove to them that you know what you are doing and you know how to lead. Well, as a leader, you should also be good in decision making. You should be good in problem solving, and you should be good in conflict management. You should also be good in the very important thing, which is communication. Um, what else? You should also be good in handling people, and at the same time, good in developing others. So if you can produce good leaders, then for me, that is a great accomplishment. Next is the inexperienced myth. When I get to the top, I'll be in control. Well, again, that is not true. Position does not give you security. It does not give you the authority to control everything, and it does not protect you. Remember, even those who are in the top management, even the director of the hospital, even the politicians, the cabinet members of the president, should not be complacent. For definitely in time, they will end their term or they will be replaced. So, my dear colleagues, there are several factors that control the organization. There is also the freedom myth. When I get to the top, I'll no longer be limited. So when you move up in an organization, remember that the weight of your responsibility increases. So you will encounter more problems, more complaints to solve, more decisions to make, and more people to handle. So the amount of responsibility you take also increases. Then the amount of the authority that you receive. And I know you will agree with me. So remember that you only have one position. And I know that all of you will agree with me. Next is the all or nothing myth. If I cannot get to the top, then I won't try to lead. This is same as if I cannot be the captain of the team, then I'll take my ball and go home. So the position is not mine. Why should I be involved? Well, again, that is not the right attitude. You can be an effective leader even if you don't have the position. As long as your goal is to help and support the programs and projects of your own hospital. Now, how can we as leaders lead our team to a crisis? Well, when faced with a crisis, most leaders are forced to think and behave in ways that feel unfamiliar, whether it's a technological, financial, natural, or health crisis at work or in the community. Crisis demand that leaders take an emergency response plan and adapt it as new evidence and factors presents themselves. Well, the coronavirus pandemic has placed extraordinary demands on leaders in hospitals and even in business and beyond. The humanitarian toll taken by COVID-19 creates fear among employees and other stakeholders. So the massive scale of the outbreak and its sheer unpredictability make it very challenging for the executives and leaders to respond. So let's discuss on how we could lead through a crisis. All the while, effective leaders are able to remain calm and maintain a sense of perspective. Well, according to Jean Klan, the author of the book Crisis Leadership, during a crisis, your goal is to reduce loss and keep things operating as normal as possible. I know that we have our own fears about this pandemic, but despite this, as leaders and staff, we still have goals to achieve. And we must set new protocols and guidelines to keep things as normal as possible. So, in other words, we must learn to adapt, for that is only the way to get through any crisis. According to an article entitled Nurse Leadership During a Crisis, authored by Carly Moore, a lead practice nurse at Oxfordshire in England, there are three central themes of crisis leadership: communication, clear vision and values, and caring relationships. So during a crisis, such as the current coronavirus pandemic, these are essential parts of nurse leaders' roles. So let us discuss each. First is communication. According to James Hume, he's a professor of language and leadership and a former presidential speechwriter. So he wrote speeches for former US President Ronald Reagan, George W. Bush, Gerald Ford, Richard Nixon, and Dwight Eisenhower. He said that the art of communication is the language of leadership. So communication during a crisis can be hindered by heightened levels of stress and information overload. However, um, timely, simple, transparent communication ensures that facts are relayed, myths dispelled, teams are empowered to make decisions. So, clear communication should always be evident because during a crisis, it becomes central. Now, what are the ways in which leaders can enhance their crisis communication? One essential information is gathered. Decide who should be informed, when and how it should be disseminated to the concerned department or person by every means possible. So you create an easily accessible central resource point. So it can be electronically or on paper. Well, we all know that transparency is key. Information is the oil that greases an organization and keeps it running smoothly. So this is especially true during a crisis. And this is true now as we are constantly revising guidelines and protocols based on new findings. We must make sure that no one is left out. Everyone in the organization must be informed and must be aware of current changes or interim guidelines approved, of course, by our top management. And this can be done through dissemination of appropriate information across the web and during team briefing in the workplace. So you can make use of the current technologies through email. We have this Viber, Messenger, and video conferences in your hospital. Next is seek credible information. Find out as much as possible from a wide variety of reliable sources. Well, nowadays, different information are readily available in different social media platforms. Example, we can see those info in Facebook, Twitter, Viber, Instagram, and others. Well, as a leader, it's your responsibility to determine the most reliable, up-to-date information from trustworthy sources. So avoid getting information only from social media and be wary of any news organizations that have political, financial, or activist agenda. So we have heard many of these things nowadays. Well, the informations may be biased and to varying degrees inaccurate. So in the current case of the coronavirus, the recommended consulting health services are of course, we all know this, the World Health Organization, the Department of Health, and the Centers for Disease Control and Prevention, where you can find advice on how to prepare and of course, take action. Next is be open and honest. You know, it's fine to say you don't know everything. It is unrealistic to expect anyone to know the answer to anything. Even me, I don't know everything. We all understand that in our daily lives, that could happen, you know. Yet, when questions are posed in work setting, many leaders feel compelled to have immediate answers. So when leaders answers too quickly, Subordinates get unrealistic example of good leadership. Next is be clear, concise, and accurate. Well, you should avoid technical details or overly complicated information. The statement should be clear and simple. Repeat key points several times because people may struggle to take in what you are trying to tell to them. Don't pad your sentences with jargons. Don't use jargons or should I say flowery phrases to sound more professional or to impress people. Recognize the time that time is valuable and that it is critical that all parties walking away from a conversation understand the relevance and importance of what was said, whether it is digital or verbal conversation. It should be tailored to the context of the discussion. Next is learn how to listen. Listening is the most important skill a leader can master. It is the basis of so many other skills and traits that make up a leader. Well, as a leader, your job is to encourage others around you to be open and honest with the negative consequence. Listening leads to personal awareness and, of course, growth. So if you do listen, you will not, if you do not listen, rather, you will not grow. Additionally, when employees offer their ideas or differing opinions, well, you should be open minded. It's always valuable to listen to your employees. Next central theme is clear vision and values. During a crisis, it is easy to become absorbed in detail and complexity, but it is the leader's role to understand the critical details of the situation, to be able to see the bigger picture and share it with them. Now, how do we achieve clear vision and values during a crisis? So first is be present, visible, and accessible. Well, during a crisis, leaders must be present. Leaders must be visible and available. Because it's not always possible to walk around your facility and talk to every person, especially on this kind of situation, as we are preventing the spread of the virus. But let employees know how they can best reach you with status updates and questions. Particularly during a crisis, employees have a need to hear from their leaders frequently. When leaders appear calm, when leaders are concerned, knowledgeable, and of course in charge, definitely workers feel encouraged and are more likely to have confidence that things are under control and will be fine. So head nurses or supervisors in the areas who are here today, your staff feels secure if your presence is there because if they need anything or if they want to ask something, you are there for them. It means that leaders and even the staff can be assigned where they are needed also. Remember, we are in a state of crisis, in a different situation. So don't expect that you will stay in your comfort zone. You are in a hospital, so the patients need you. You can and you will be pulled out anytime, wherever and whenever you are needed. Next is lead by example. Good leadership takes strength of character and a firm commitment to do the right thing at the right time for the right reason. This means doing what you say when you say it. So if your team cannot trust you, you'll probably never lead them to greatness. But when you lead by example, you create a picture of what is really possible. The people can look at you and say, well, if we can do it, I can do it too. So when you lead by example, you make easy for others to follow you. So remember, don't talk, you act. Don't say, you show. Don't promise, you prove. So, next is take responsibility. Do not wait for the crisis to resolve itself. Take charge of the situation. Seek out the necessary information and support. If there are issues, if there are concerns, instead of spreading blame, spread accountability. By taking your share as a leader, you will inspire others to hold themselves accountable for the issues too. This builds long-lasting trust and sets you up for prolonged leadership success. When you own the problem, you can own the solution too. So enlist people to help so that they can feel engaged in the solution with you. Next is provide education and training. Well, in this time of pandemic, for education and training must be continuous. Our staff needs it not only for professional and personal development, but most importantly, so that they can carry out their work effectively and safely, both for them and of course for the patients. We have several online platforms now for training and education, and we must take advantage of it, just like what we are doing now. Next is empower people. For me, one of the most important ways to become a more resilient leader is to empower people and, of course, develop others. The most resilient leaders are not only interested in their own development, but they are also concerned about the development of others. Developing others help everyone to learn from their mistakes. So let me share with you my life's mantra. This is my favorite. Failures cannot overcome you if your determination to succeed is strong enough. So if you were able to develop others as a leader, I can say that you are accomplished. Rosalind Carter said, a leader takes people where they want to go, but a great leader takes people where they don't necessarily want to go, but ought to be. The last central theme is caring relationships. Successful crisis leadership involves responding to the emotions caused by the crisis. Leadership is pivotal in bringing staff together to, of course, acknowledge shared distress, affirm suffering, and help the team cope. You know, the staff may need to express their feelings and be listened to. Supporting them emotionally may require nurse leaders to relax their boundaries and connect on a human level. Leaders must also give themselves permission to acknowledge their own wide range of emotions. And finding positive, high quality support can enable them to provide the same for their colleagues. So, how do you support your team and yourself emotionally during a crisis? Well, you should reassure that all emotions are normal. Remember, stress means you are just human. Next is control what you can and accept what you cannot. And try to keep to and encourage a routine. Encourage a healthy work-life balance and regular breaks. Help the team connect and set aside time for rest. When employees feel a greater sense of control and ownership and over their own lives, they tend to have better relationships with management and are able to leave work issues at work and home issues at home. Balanced employees tend to feel more motivated and less stressed out at work, which thereby increases company productivity and reduces the number of conflicts among co-workers and even in the top management. So we should encourage people to discuss their experiences and emotions So listen to the staff, their needs, and guide them to helpful resources. Be compassionate towards yourself and others, and involve all staff in developing future preparedness plans. Celebrate also what we went well. This is very important. Give thanks and rewards. Share positive experiences, and of course, share, express, or appreciation to staff. Success can beget success, and celebrating at work helps to build momentum, improve morale, and make the hard times feel all the more worth it. What do we need now in times of crisis? Well, we need to be a resilient leader. A resilient leader is a person who sees failures as temporary setbacks they can recover from quickly. Well, we know the meaning of resiliency. So in Filipino, kailangan mong maging matatag. Leaders should maintain a positive attitude and a strong sense of opportunity during periods of turbulence. When faced with ambiguity, a resilient leader finds ways to move forwards and avoid getting stuck. When we look at people with a strong preference or for resilience, we found they were quick to take action and, of course, act independently. They were also more willing to take risks and make decisions quickly. Being resilient as an individual and being viewed as a resilient leader requires that you bring others along with you. Now, I would like to share with you some of what my staff have experienced on the battlefield against the coronavirus. So this is already sharing. When the pandemic hit the borders of our country last March 2020, last year, nurses were called to serve our countrymen. Each had to leave their families in order to care for the sick and affected. With a shortage of nurses in the Philippines, implying a state of havoc and disarray for the medical system, especially in the current situation in the country, hospitals still manage to have its spirited and strong-willed nurses fight a war they were not prepared for. In our institute, the National Kidney and Transplant Institute, the nursing workforce served as the backbone on the front lines, fighting against the invisible adversary, the COVID-19. Well, I do believe that we empower each other by being connected to one another, communicating our needs and, of course, our differences, and showing camaraderie every step of the way. Yes, there are staff issues because they are also afraid. They are anxious. But we make sure that leaders are there to support them and help them along the way. At the start of the pandemic, nursing staff have been working for long, grueling hours, finding themselves risking their lives every day. So in NKTI, there are certain practices that are enhanced and modified in order to care for those affected by the virus. The nursing services, in coordination with the Infection and Prevention Control Committee, has conducted trainings for the nursing staff for proper donning and doffing of personal protective equipment and infection control measures to help protect patients and healthcare workers by performing procedures, of course, according to best practices, and be continually equipped as NKTI opens door to care for COVID suspects with renal comorbidities. The practice of physical distancing and, of course, the hand washing was really overly emphasized, as these are the two of the most effective ways to prevent the spread of COVID-19. And I know that most of the hospitals are doing the same. Along with the increasing number of COVID-19 cases worldwide, came also the global shortage of the PPEs and other necessary supplies during the start of the pandemic. Safety concerns are high given the dearth of protective equipment. Nevertheless, with endless support from both the private and the public sectors and others who are willingly share in the spirit of bayanihan, donations and help for our frontliners are coming from all parts of the region. It is good to know that it is easier to acquire PPEs now, unlike during the start of the pandemic. So where most of our PPEs came from donations from different local and private organizations and even individuals. In our efforts to combat the current health crisis, the Philippine government has procured vaccines from China, UK, USA, and Russia for now. So the rollout of vaccines, given the limited global supply, should be based on a prioritization framework to ensure that those who have the highest risk exposure will be protected from the disease. So this is the NKTI COVID-19 vaccination team 2021. So the COVID-19 vaccine rollout last March 1, 2021 marked a historic event as the government began its biggest vaccination drive in scale following the receipt of I think 600,000 donated CoronaVac doses. So on the first day of the rollout, at least 756 frontline healthcare workers from 6 hospitals in Metro Manila received the Sinovac CoronaVac with the Philippine General Hospital's Chief Dr. Gerardo Legaspi being first to be inoculated in our country. Well, I was also able to take part in this historic milestone in our country as a nurse wife who vaccinated her doctor husband. So this was also featured in Rappler, Manila Times, and Nurse Updates. Well, along with the nursing leaders, we continue to conduct leadership meetings. Actually, we are doing this every Thursday during our nursing audit to constantly plan and address concerns arising both in the administrative and even in the clinical areas. Schedules were strategized in a way that the staff will be able to prepare, have ample time to rest, and regain strength before coming back to the battlefield stronger than ever. Well, it was mid-March when those affected by the outbreak started um, swarming in hospitals. Well, should I say NKTI, being the premier hospital catering to renal patients, then accepted cases with renal complications. The nursing staff were at first overwhelmed, given that most did not anticipate the burgeoning of these cases in the Philippines. But eventually, over time, they were able to find ways to cope with the hard reality that every person is really battling. Because of this, when I heard about they are being discriminated, my staff, they're being discriminated or being driven away by their landlords in their communities and in their barangays, I personally wrote a message of hope addressed not only to the healthcare workers, but to the community as a whole. It was published in nurseupdates.com, and surprisingly, it was also shared by Rappler, Inquirer, Manila Times, Manila Tribune, Metro News Central, Go Cavite, Go Batangas, and other media platforms. Aside from that, I also wrote a letter to all my more than 800 staff, giving them hope and of course encouragement, saying, kamusta ka? Mag-ingat ka, sampu ng iyong pamilya. Well, it is my way of reaching out to them, as I cannot personally talk to them every day. I wanted them to feel that they are valued and that the whole institute remembers and appreciates all their efforts and all their sacrifices. NKTI was not immune to the virus, as more than 200 plus of my staff tested positive. With this, I felt the need to write them another letter stating that I am with them and that they are all in my prayers. Well, it is the nurses' appeal to the society whom they are serving that they be treated with respect and sympathy and not be treated as outcast by being disease carriers. The nursing personnel, of course, we sincerely appreciate the empathetic citizens who have volunteered in donating whatever they have to help, from the meals given down to the PPEs in any form, and even prayers offered every day. These things help them realize that, they are not alone in this battle. These things give them courage to continue in the fight of serving Filipinos in this COVID war until we win it. So, my dear colleagues, I just want to inform you that there is pain for leaders too. It's not easy job to be a leader. What the staff is experiencing can also be felt by leaders. Why? This is my personal experience that I would like to share with you. Every time I talk to my staff and hear them cry, I feel their pain. Especially if they will say, Ma'am, paano na po ang pamilya ko? Paano na po ang mga anak ko? Masaswab din po ba silang lahat? Saan po kaya ako pwedeng tumira? Kasi po maliit lang yung bahay namin. Iisa lang po yung kwarto. Ma'am, natatakot po ako. Ano po ang gagawin ko? Well, hearing these words breaks my heart because I know that I cannot cure them of their infection. But what I can give them is my support and, of course, prayers and concern. We are very lucky because it is good that the government and other private sectors are helping us provide accommodations and even transportation for our healthcare workers. In the COVID, if the COVID positive staff cannot quarantine at home, we have a partner hotel where they can stay. Those who cannot go home because of transportation problem, we also have a transportation facility for them or accommodation for them. We also have accommodation for them. We also coordinate transportation for them. And we really truly thank, those who are helping our healthcare workers, especially during the start of the pandemic and up to this time. Above all else, the biggest and perhaps the hardest sacrifices a healthcare worker can possibly give would have to be the time spent away from their families and loved ones in these times of crisis. These sacrifices are the realities lived by these people nowadays, especially our staff who are there in the battlefield. Through this, they are able to save lives, even if it means putting their own at risk. I know that no monetary or other incentives could, compensate to the work and sacrifices of our healthcare workers. But I really believe that we are all tirelessly working because the nurses, the doctors, like the rest of the other frontliners, are aware of their chosen profession and the risk that goes with it. And we have pledged to do our duties no matter what. So it is our passion and our calling to serve the Filipino people during these trying times. My dear colleagues, every day we are faced with the threat of COVID-19. That is why I would like, to give credit to all our healthcare workers on how resilient they have become despite the impact of this crisis, both physically and psychologically. We all hope for an end and a cure to this disease, and the world continues to adapt to the changes that needs to be done to achieve this. Always remember, great leaders don't set out to be a leader. They set out to make a difference. It's not about the role, it's always about the goal. And before I end my lecture, I would like to say to all of our leaders and to soon to be leaders, we are not blessed because everything went right. We are blessed because we got the fight. Thank you and keep safe.
Thank you very much, Dr. Jerial. Indeed, you are an epitome of a good nursing leader and an advocate of nurses' welfare in the National Kidney Transplant Institute. Dr. Jerial, no, I learned that courage, boldness, faith, and the will to try and never give up, even in the most trying of times, is very important. And of course, thank you for imparting your knowledge and expertise to our fellow nurses on how to lead, no, in the time of crisis and provide quality care in uncertain times. Thank you very much, Dr. Jerial, and mabuhay po kayo. And with this, we would like to award a certificate of recognition to our plenary speaker on the topic effective nurse leadership in times of crisis. The certificate reads, the Philippine Nurses Association Incorporated Region 6 Council, Western Visayas, Philippines. Certificate of Appreciation is awarded to Nerissa M. Jerial, PhD, RN, for her valuable involvement as plenary speaker on the topic Effective Nurse Leadership in Times of Crisis during the 2021 PNA Region 6 Summer Conference with the theme Nurses, Voice to Lead, a Vision for Future Healthcare, conducted via Zoom on May 21, 2021 from 8 a.m. to 12 p.m. Philippine Standard Time. Signed, Aris Kendall Arpongabong, President, PNA and PICA Chapter, and Leia P. Alayon, Governor, PNA Region 6. A virtual applause, please, for Dr. Jerial. And I am sure you have a lot of questions regarding the topic of Dr. Jerial. Kindly comment in our comment section so that later on, during the interactive discussion, we can read your questions. Dr. Jerial, there is a feedback coming from Eden Escorpion. She loves your topic. Simple and reality-based examples. Thank you very much, Dr. Jerial. And now, ladies and gentlemen, let us proceed to our next plenary speaker. We now proceed to plenary session number 4. Investing in a safe and effective workforce, continuing professional development for nurses in the Philippines. Our next speaker is a member of the Professional Regulatory Board of Nursing, the Professional Regulation Commission, and the chairperson for the PRC CPD Council for Nursing. She was the PNA National President in 2018 and a former nursing faculty and graduate school professor at University of St. LaSalle. Ladies and gentlemen, our very own Honorable Merly L. Salvani. A virtual applause, please, for our next panelist. Dr. Merly, please take it away.
Good morning, Joe Fred. Hello. Thank you for that very wonderful introduction, Joe Fred. First of all, I would like to greet a pleasant morning all my fellow nurses from Region 6 and other areas of the Visayan region, as well as Luzon and Mindanao. I would like to mention my two former colleagues in the PNA, two former governors are here with us. Governor Victor Quimen of Region 3, and of course, Governor Crans Espartero of Region 12. Welcome to Region 6. First of all, I would like also to say happy Nurses Month of May. It's still May. So I would like to greet you, happy Nurses Month of May. I would like also to say thank you to PNA Region 6 for inviting me once again to be with you all today. It is indeed a pleasure and an honor to be back to my very own region, the region that I have cared and loved for the past 4 years when I was the regional governor. I would like to say thank you to Dr. Alayon and to the PNA host chapter headed by Ares in inviting me again, and of course, all other members, the council members of PNA Region 6, okay, the chapter presidents, as well as the members. I could still feel the love and support you gave me when I was your regional governor way back in 2015 and 2018. So today it is a throwback time to me to give back to the region that really helps me a lot to push me up to where I am now today. So my topic today is investing in safe and effective workforce, continuing professional development for nurses in the Philippines. This is one of the topics that my fellow nurses, I believe, would like to love and hate. Am I correct? Okay. Now also, what a coincidence, because in 2018, when I was the national president, my major advocacy and initiative was about to bring CPD to every nurses in every corner of the Philippines, as far as Luzon, Visayas, and Mindanao. Because that time, the requirement was really big that PNA would like to respond by really bringing the CPD program to far-flung areas of the country to serve our fellow nurses. So now when I assume the PR board of nursing membership, when I was given the initiative, what a coincidence. I was given also the initiative to chair the Nursing CPD Council. Okay, so today I would like to update you what is really happening in terms of the CPD program in the country. Is it going away, or is there something good that we have to look forward, my fellow nurses? So next slide, please. Okay, first of all, let us answer the question, why invest in safe and effective nursing workforce? My fellow nurses, okay, according to ICN, nurses are the largest in number among the health professionals. And this was made known in the State of the World's Nursing Report 2020, made by the International Council of Nurses. Around the globe, there are more than 26 million nurses worldwide. So that is why the reason that we really have to invest in safe and effective nursing. Now also, according to ICN in 2020, we nurses are central to health system of every country. In other words, we are the movers of every health system in the country. So therefore, it is very important that we need to be safe and effective in the delivery of our care. And very important, according to ICN, we are the heartbeat of any healthcare system. So this alone, my fellow nurses, are very inspiring to note that indeed investing in safe and effective nursing workforce is really important today. Okay, next slide, please. Now, according to the World Health Organization, with its partners, International Council of Nurses and Nursing Now, a properly resourced, educated, and valued nursing workforce can enhance the health and well-being of everybody in the planet. Yes, my fellow nurses, okay? So what matters most is that we, professional nurses, are really into positive patient outcomes. In other words, if we are trained that much, if we are highly educated, we are continually educated, we are enhancing our skills, values, and knowledge-wise, we could really make a difference in making positive patient outcomes. Next slide, please. Okay, so investing in safe and effective workforce to continuing professional development through CPD. Now, this is not only in our country, but this is now a worldwide phenomenon. Most of the countries now value the importance of continuing professional development in ensuring safe and effective nursing workforce. So in our country, I would like to say, my fellow nurses, CPD is a mandatory in our country since the law was enacted way back in 2016. Now we are 2021 and it is still mandatory. But I would like you to believe that at the end of the day, something good is going to happen with this CPD. In other words, it is not only for the renewal of your license, but it is something for the betterment of the nursing profession in our country. Next slide, please. Okay, so as I mentioned, CPD in the Philippines is mandatory because we have a law that mandates the implementation of the continuing professional development for all professionals in the country, which are regulated by Professional Regulation Commission or PRC, including nurses. Next slide, please. Okay, so this is the law that mandates CPD in nursing in the Philippines. Okay, it is known as Republic Act 10912, an act mandating and strengthening the continuing professional development program for all regulated professions, creating the Continuing Professional Development Council, and appropriating funds therefore and for other related purposes. Section 1 title, this act shall be known as the Continuing Professional Development Act of 2016. Okay, next slide, please. Now, why do we have this CPD law in the country? My fellow nurses, first and foremost, in our Philippine Constitution, it is embodied that it is the duty of our state to enhance the competence of every professional in the country. So that is the legal basis of this law, why it was enacted in 2016. Now, also in our Republic Act 9173, it also is clearly mandated that we nurses should really go into continuing professional development activities. Okay, so Republic Act 10912 or the CPD Act of 2016 was enacted in 2016, which is also known as the Continuing Professional Development Law. The principal proponent of this law was Senator Antonio Trillanes IV. The law mandates the Professional Regulation Commission or PRC as the primary implementer of the law. That's why all regulated professions under PRC are mandated to really go into this CPD program. Republic Act 10912 was enacted to promote and upgrade the practice of the profession in the country and institute measures that will continuously improve the competence of the professionals in accordance with international standards of practice, thereby ensuring their contribution and uplifting the general welfare, economic growth, and development of the nation. Okay, so this was the purpose of that CPD law, which was enacted in 2016. Okay, so why is CPD required in the Philippines? Number one, nurses have to expand knowledge and technical competencies. Yes, my fellow nurses, what we have learned in school 10 or 20 years back may no longer relevant today. And remember, we are dealing with human lives. Healthcare keeps on evolving every day. So in other words, we also need to be updated. We need to expand our knowledge. We need to enhance our competencies so that at the end of the day, we are able to deliver safe and effective care to all our clients in every work setting. Second, CPD is vital for nursing staff to maintain and develop their skills they need to deliver high quality, safe, effective care across all roles and settings. Okay, so no other limitation but this. Okay. Now, CPD is also required in line with meeting the Asian Core Competency Standards, where there is a need to continuously update themselves in order to meet the different challenges. Remember, our country is a member of the ASEAN countries, okay, the 11 ASEAN countries, to allow free movement and employment of our nurses in other ASEAN countries. We need to prove that we have these credentials and certification, that we have continuing professional development programs for our nurses in the country. That is why, my fellow nurses, wherever we are across the globe, we are still recognized by every country that we are the best nurses in the world, the choice of the world, the best for Filipinos. Okay, so today there is an international evidences, a lot of evidences that CPD is vitally important for nursing staff in terms of professional and personal development and in contributing to improve patient outcome. So not only here in our country, but across the globe. Every country now has recognized the importance of CPD, okay, to their staff nurses, okay, as shown by the various international evidences, okay? Now, aside from investing in safe and effective workforce, okay, in our country, CPD is required to renew our professional identification card, our PIC, or our license card. Okay, remember that initially the requirement was 45 units. Okay, so that means for the 3 renewal cycle or 15 CPD units a year. Now, how did we react, my fellow nurses? Okay, when it was 45 units. Okay, next slide, please. Okay, now professionals like nurses and teachers decried the implementation of the CPD law. To them, it was kind of unnecessary, burdensome, due to high cost of attending CPD programs. Am I right? That's why I said in 2018, I really took pain to go around the country as far as Luzon, Visayas, and Mindanao, because that time PNA was one of the main providers of CPD from the national level cascaded to the regional and local chapters, as well our chapters, PNA chapters abroad. Okay, so I brought along the CPD program so that our fellow nurses would really avail of the CPD units, which was 45 then. Okay, so there were a lot of issues related to affordability, accessibility, and availability, which really reached the attention of Senator Trillanes, the principal proponent or author of this law, as well as other senators like Senator Ralph Recto and Miguel Zuberi, okay? So that the implementation of the CPD law really met major public backlash. No? So the public really basks, okay, the CPD law, because to them it's really burdensome and it really made them spend a lot, not just to get that 45 CPD units. Okay, next slide, please. Next slide, please. Okay, so what happened now? Senators Trillanes, Recto, and Zuberi urged the PRC and the CPD councils and members to look into the implementation of the CPD law so that in February 27, 2019, through Resolution 2019-1146, PRC and CPD councils came up with an IRR amendments that took effect March 1, 2019. So with that, there were amendments and some exceptions to the existing CPD law. Okay, next slide, please. So what were the salient points in those amendments? Now, PRC provides a transition period for professionals to comply with the CPD units required. Okay, we are still enjoying that transition period, my fellow nurses. But mind you, this is only temporary. Soon it will be amended again because, as I've said, time will come that the CPD will no longer be a requirement for the renewal of our PRC card. It will be more than that. Okay, so the following are observed during the transition period. Number one, overseas Filipino workers, nurses are not covered by the CPD requirement. Okay, they are exempted. Nurses are only required, so from 45, it was reduced to 15 CPD units for the 3 renewal cycle, meaning only 5 CPD units per year. Okay, so from 45, it was good news to 15. Okay, next slide, please. Newly licensed professional nurses are not covered by the CPD requirements. The first renewal cycle after obtaining their professional identification card. Okay, so once they passed, they got their license, for the next renewal cycle, they are exempted. Okay, another various CPD council shall reduce the required CPD units to a minimum which should not be more than 15 CPD units. So for the nursing CPD council, we responded to 15. Okay, now professionals who lack CPD units were able to renew through affidavit of undertaking shall only comply with the required number of units as amended pursuant to this resolution, equivalent to not more than 15 credit units. So even if you lack units or none at all, you could still renew your license because of that affidavit of undertaking which was provided by the PRC as part of the transition period to make it easy to all professionals, including nurses, okay, to renew their PRC card. Next slide, please. Okay, so PRC, okay, has this program of maximum flexibility. PRC is still very flexible in the implementation of the CPD requirements, and it allows renewal of professional identification card without full compliance. Okay, nurses lacking in CPD units may continue to renew their PRC card until December 31, 2021 of this year. So that is part of the maximum flexibility program of the Professional Regulation Commission. Okay, so my fellow nurses today, okay, CPD, I believe, is no longer new to us. We get used to it. We consider it as part of our daily routine. We consider it as very important in enhancing our competence, our knowledge, our skills and values as well, so that we become safe and effective nurses to all our clients. Vis-a-vis a requirement for the renewal of our license card. Okay, today we still have a wide array of CPD programs which are accredited by the Nursing CPD Council in order to earn CPD units. Okay, number one, you could make use of your professional work experience. The very work that you do in your workplace could become your CPD. What are you going to do? You just make a narrative detail of the work that you do, time and motion. Please do not forget to write the date, because the date of your work experience is very important, my fellow nurses. Okay, focus on the things that you do as nurses every day in your workplace, and make sure the certification is certified by the head of your office. So that's one. Okay, you may also have formal learning in which, okay, through your going back to school in higher education, you could have your masteral, your doctoral or postdoctoral degree. Okay, the non-formal learning are this type of learning that could augment okay, formal learning. These are the CPD activities which were approved by the CPD Council. Not that we are having the pandemic, most of our CPD programs are virtual in nature and usually free, my fellow nurses. Okay, no? So it's easy today for us to really embark or engage in non-formal learning. Yes, because in your very own workplace, okay, now many times your own workplaces have become providers of CPD programs today, and they are very dynamic actually in providing CPD programs to their staff nurses. Then we also have informal learning. Okay, then very important is our self-directed learning activities. Okay, these are activities, okay, without prior CPD units that you do your own. You do it your own in relation to your profession. Okay, for example, your volunteer work, your research work, and other activities, especially today as frontliners. Later, I will discuss with you, okay, what are the things that you do in this COVID-19 pandemic acting as frontliners, okay. Then today also we have the online learning activities. Nah? Okay, there are many today. Okay, so these are, okay, some of the very important CPD programs which are available to you today. Okay, so in other words, earning CPD units even at the time of the pandemic is no longer a problem, my fellow nurses. No, as I said, and I do believe, it now become a part of our daily routine, our own lifestyle, because we really would like to go up into our competencies. We would like to go up in enhancing our knowledge, our skills, and values as well. Okay, next slide, please. As of today, my fellow nurses, look, there are 365 accredited CPD providers in the country. So when I sat down as the chairperson of the Nursing CPD Council, I was really amazed to see how many are now providers in the country. Okay, so we have big nursing organizations, accredited nursing organization, Philippine Nurses Association, ANSAP, CCNAPI, ORNAP, MCNAP, ADNEP, EuroNAP, okay, in which it's headed by Dr. Jorial, and many other nursing organizations are providers today of CPD programs for nurses. Then we have the academe, the colleges of nursing, hospitals, both private and government. The Department of Health now are really responsive to the call to become providers of CPD programs to nurses who are really working, especially in the government sector, okay? So as we receive applications every day, okay, now it is really amazing that DOH is also very dynamic in terms of providing CPD programs, okay, under the jurisdiction of the nurses, under the jurisdiction of the Department of Health. Okay, so it's no longer a problem today to look for providers, okay? When in fact, my fellow nurses, the CPD, the Nursing CPD Council, or the CPD law by itself really encourages every employer to put value to the importance of continuing professional development to all their staff, especially to nurses. That is why in many of your workplaces, you already have that CPD program in place in your work. And very dynamic to provide you with a wide array of CPD programs. Okay, next slide, please. Okay. So the Nursing CPD Council at the very start of the CPD law, the Nursing CPD Council was created and mandated to evaluate, accredit, and monitor the implementation of the approved CPD program. Okay, so basically the composition The composition of the CPD Council. Next slide, please. Next slide, please. The composition of the CPD Council, as the chairperson, it is usually headed by the PR Board of Nursing. And for this year, I was appointed through a resolution of PRC, CPD Management Council, that I will head the Nursing CPD Council. And I have an alternate in the person of another PR board member, Honorable Carfreda Dumlao. Okay, next please, next slide. Now the first member is the Accredited Professional Organization of Nurses. Okay, today we have the Philippine Nurses Association represented by its president. So today we have Mr. Melbert Reyes, the current president of the PNA, the first member of the CPD Council. He is still going to take his oath, okay, sooner. Okay, his alternate is the immediate past president of PNA, represented by Dr. Rosie De Leon, the past president of PNA last year. Then the second member is represented by the Association of the Deans of the Philippine Colleges of Nursing in the country, represented by Dean Elizabeth Rojas. And her alternate is Dean Edna Emperia. Together with us, my fellow nurses, to make work easy for us, we have a list of evaluators and monitors. Mind you, my fellow nurses, when I was appointed as a chairperson of the Nursing CPD Council, we have so much backlogs in terms of our applications of our CPD. Now, why such a backlog? Because of the pandemic, which started off last year in March 2020. It was really difficult for our CPD Council to go to PRC to evaluate and accredit those applications which were manual in nature at that time. Okay, plus of course with the transition period, there were new appointees of the PR Board of Nursing. Okay, there was a transition period and PRC has a protocol. Okay, that for every new appointee, it should be backed up by a resolution. Then she or he has to take his oath of office as chair or member of the CPD Council. Okay, so my fellow nurses, it's a good thing. Last October 2020, okay, our CPDAS, our online system, was already very functional, and thank God for that, okay? It really made our work easy. We were able really to fast track those backlogs. And I would like to inform you, my fellow nurses, with pride and honor, that together with the CPD Council members, and our list of nursing evaluators, our esteemed nursing leaders from different nursing organizations. I could not name them because there are many of them, okay? Now we were able to fast track. So today, our online system is already cleaned up to May 2021. Imagine that, nah? Okay, but the only problem we have is our manual applications, which are still at the PNA office, okay? Now, we were supposed to strategize those manual applications to be sent to us, okay, through online despite the pandemic. But because of COVID-19 surge, PRC issued a memorandum to all personnel and staff that nobody is going to report to any PRC office. So again, we got stalled, okay, in our manual applications. But mind you, my fellow nurses, now that we have the GCQ, we are going to continue with the strategy to really convert those manual applications to online, evaluation and accreditation, so we're able to fast track, okay? So on behalf of the Nursing CPD Council, I would like to say sorry for the inconvenience. that the delay in the processing of your applications as providers and for your CPD programs. Okay. Now, because, as I've said, because of the pandemic, and because of the transition period. Okay. Now, with the present CPD, Nursing CPD Council, we really responded to that, urgency of really approving and evaluating, accrediting, okay, our backlogs. Okay. So now, okay, so how do you now undergo your application for provider as a new or renewal? Okay. Now, also the accreditation of your CPD program. A CPD provider shall apply for accreditation of its program to the CPD Council. The CPD provider shall indicate the number of times the program will be offered for monitoring purposes. Okay. By the way, my fellow nurses, okay, starting this May, we will strengthen the monitoring and evaluation of the implementation of our CPD programs. Okay, so in other words, in your succeeding CPD programs, okay, you will be assigned a monitor and evaluator, okay, to really evaluate how you implement the approved CPD program by the CPD Council, okay, and with that, he or she is going to make a report as to her observations and recommendations, okay? So this is the call of PRC CPD division that we have to strengthen our monitor and evaluation system so that the implementation of our CPD programs will be with quality, okay? Next slide, please. Okay, so as I've mentioned today, we have 365 CPD providers. An accredited CPD provider, okay, of a particular profession may apply for accreditation of its program or programs to CPD Council of other professions, subject to the approval of the CPD Council concerned, okay? My fellow nurses, you might design a program that is multidisciplinary in nature, meaning it's not only intended for nurses, but other disciplines could also avail of that particular CPD program, okay? Now, all you have to do is, okay, aside from applying with the CPD with the Nursing CPD Council, you are also advised to apply with the other CPD Council of the other professions to be evaluated and accredited for such, okay? That is already a common thing today that many CPD providers go into multidisciplinary CPD programs, making sure that the programs are available not only to a particular profession, but to other disciplines as well. Okay, in other words, okay, it is really very important that we help one another, especially in this time of pandemic. We could not go solo anymore, but we have to share our resources. That is why we really welcome those other disciplines who will apply to us because their programs are also intended for nurses, okay? But mind you, my fellow nurses, we only approve and accredit the program, the part of the program, which is intended for the nurses. Okay, next slide, please. Now today, in-house training programs and capability building activities of the government, okay, agencies and corporations, including local government units and private employers, shall be accredited and considered as compliance of their employed professions. Okay, so if you have in-house trainings in place in your workplaces and capability buildings, you could apply now those, okay, as your CPD programs. Okay, so today now, okay, as I've said, since October 2020, something good happened to us, although this happened already in 2018, but it came to realize and became more functional in the midst of the pandemic. In October 2020, PRC Continuing Professional Development online assessment system, or the CPDAS, became so operational and functional. What does it mean, my fellow nurses? Meaning starting October up to the present time, there will be no more manual applications to CPD providers as well as CPD programs. All has to undergo into the CPDAS online system of PRC, which is user-friendly, by the way. Okay. Now, also, I would like to emphasize to the CPD providers, especially in designing your programs. This is my common observations, my fellow nurses. Okay. Now, in designing your instructional designs, your programs, please put more weight on the actual transfer of knowledge, content-wise, okay? Go away with the ceremonial, routinary activities because it will never earn you CPD units. What is important is the actual transfer of knowledge from you as provider to your participants, okay? And also, I would like to appeal from you, my fellow nurses, okay, as providers, okay? Remember, we are now into level 7. We are no longer at level 6. Level 6 is only for BSN degree, no? That is our basic nursing education. Now, with the CPD programs, in providing CPD programs, you are being advised to offer advanced knowledge in nursing that is equivalent to level 7, meaning okay, a knowledge that will develop the professional competencies of every nurse professional who will be availing of your CPD program. Okay, so this level 7 is based on the Philippine qualifications framework. Okay, so when we look at your CPD instructional design, first of all, we scrutinize, okay, the kind of objectives that you set forth, okay, in designing your CPD program, okay? And I would like to inform you, as I've said, the CPD really had become a part of our lifestyle because most of our CPD providers really adhere to level 7 objectives of the Philippine qualifications framework. And I would like to congratulate most of you here or all of you here, our 365 CPD providers, okay? So this is our CPD accreditation system, now the CPDAS in short, okay, which became functional in October 2020 up to the present time. So no more manual applications. Okay, this is user-friendly, easy for you to use, okay? But mind you, my fellow nurses, okay, once your CPD program is approved, okay, at the CPDAS, and if you want to make changes, for example, changes in your speakers, changes in your schedule for reasons beyond your control, please write a letter, okay, notifying through the CPDAS that you change your speaker or your schedule in implementing your CPD programs, okay? Or better, you write your letter, you also send your letter to me through my email address or the CPD Council, okay? So that we could also respond well and not disqualify your CPD application, okay? Remember, the CPDAS online system is very friendly, but it is also very strict in terms of implementation, okay? So your application should only be based on 15 working days, my fellow nurses, okay? So since basing on the time of the implementation of your program, it should only be 15 working days. It should be like that, no? So the CPD online system is already programmed, okay, with such that you could not get away with it, no? You could not fool it. It's already programmed. It will tell you whether you are in or you are not in terms of your application that is good for 15 working days. Okay, next slide, please. Okay, so with COVID-19 pandemic, Professional Regulation Commission, or PRC, responded to the sacrifices, okay, the hardships of our frontliners, all professionals, especially our health workers who serve as frontliners during this COVID-19 pandemic. Okay, PRC issued resolution number 1239, granting continuing professional development credit unit to all professional providing essential services during the state of health emergency due to COVID-19 disease. And this include nurses. Now, this is the good news, my fellow nurses. Despite we are in the middle of the pandemic, PRC responded to our plight. Responded, PRC recognize your effort, your sacrifices, and your hardship, which is also supported by all the CPD councils, in particular, our nursing CPD council. Okay, now, okay, next slide, please. So in this resolution 1239, next slide, please. Okay, in this resolution 1239, okay, now there are specified nursing activities that could earn you or grant you as high as 45 CPD units. Take note of that, my fellow nurses. As frontliners, you could earn as high as 45 units. Okay, number one, what are these nursing activities? Contact tracing. Okay, then number two, when you provide actual care, okay, to your COVID-19 patients in the hospitals or any other facilities. Okay, another, you also assist in the distribution of relief goods and other materials needed for COVID-19, needed in the fight against COVID-19. For example, PPEs and other materials. Then also when you are providing health education or health information. Okay, that's another nursing activity that could earn you, as I've said, as high as 45 CPD units. Next slide, please. Okay, so as frontliners, as I've said, it could earn you as high as a maximum of 45 CPD units. Okay. Now, what is the criteria, my fellow nurses? Okay, now we have a template based on the length of your serving as frontliners. Okay, so it may range. Okay, it may range as from 7 days to 15 days to 30 days or more. Now, when can you earn the maximum of 45 units? When you provide activities as frontliners, okay, from 30 days or more. Okay, so in other words, you have to submit to us a very authentic and supporting, a very strong supporting documents in the form of number one, certification. Okay, certification, okay, from your employer or head of office. Okay, in that certification, there is a narrative detail of what are the activities that you do as frontliners. Very important, my fellow nurses, please do not forget to write the date, because as I've said, you could earn the CPD units, okay, from 7 days to 15 days to a maximum of 30 days or more, okay? So meaning, if your activities as frontliners is less than, okay, 30 days, that means to say you are not going to get a maximum of 45 CPD units, okay? And mind you, my fellow nurses, today, there are already a lot of frontliners who were really granted a maximum of 45 CPD units as frontliners, okay? Because they have submitted a very strong document, okay? Certification from their employer or workplaces, stipulating, okay, the narrative details of their activities as frontliners. Then very important, as I've said, the dates of you as working as frontliners. Then plus other supporting documents like pictures, very important. Okay, so pictures like this. Now, what do you do as frontliners? Please submit those to be able to earn as high as 45 CPD units. Okay, now, no need for you to attend a webinar, to get 45 CPD units. All you have to do is submit, in the form of self-directed learning activities that you act as a frontliner, since when, up to when, and what are your activities, supported by, as I've said, by authentic, very strong documents, certification plus pictures, and other documents, So as frontliners, you have many things, many activities that you have done, So please do not stop yourselves from submitting those documents. Next slide, please. Next slide, please. So moving forward, my fellow nurses, as I've said, many of us did not really like to begin with CPD because to us, it was kind of burdensome. But with the transition period of PRC, the 45 reduced to 15, to us, it was good news. But mind you, my fellow nurses, the transition period will not last forever. As the saying goes, all good things in life never last forever. Walang forever sa good things in life, especially the transition period of PRC, in which we really enjoyed the 15 CPD units. Sooner, it will be amended and be back to 45 CPD units or more. So watch out for that. And please, I would like to appeal from you to please have that mindset, have that positive thinking that something good will happen to you, my fellow nurses, Now with this amendment to the transition period, now CPD Council, the Management Council of PRC, now have realized that CPD will no longer be required to renew your PRC license. In other words, it will be passé anymore, when in fact, there is now a survey going on with all the CPD councils of PRC, all professions, Now with the choice of renewing our PRC license from 3 years to 5 years, We do not know yet which one. Is it the every 3 years or every 5 years? Because as I've said, the PRC renewal will no longer be calling for the CPD units, But something good is going to happen. In other words, your CPD units that you earn from attending your CPD programs would now move to accumulation of credit units, moving towards to career progression and specialization towards advanced practice in nursing and career tracking. So my fellow nurses, this is the good news now, that if you are a nurse, for example, you never went to graduate school to earn the masteral or the doctoral degree. Now, this is your opportunity through the accumulation of credit units with the career progression and specialization and credit transfer system coming our way that will really help us in our career tracking. In other words, sooner the CPD units could be converted into academic units in the graduate school program. Isn't it good news, my fellow nurses? So even you did not go to school to earn your masteral or doctoral degrees, you could still earn this, this career progression and specialization credit units, So this is good news. When in fact, my fellow nurses, we are now piloting, through our core group, the PR Board of Nursing and the CPD, the Nursing CPD Council, represented by 3 specialty nursing organizations. We are now exploring all possibilities how could we convert our CPD programs into that credit unit that sooner it will be also recognized and accredited by the graduate school program. Isn't it good news, my fellow nurses? Okay, so this is one good news that I would like you to really go into as we move forward to the implementation of the CPD program of nurses in the country. Okay, so gone are the days, it's no longer for the renewal of your PRC, but something good. That is for, okay, going up into your career path, okay, through our career progression and specialization, and of course, advanced practice nursing. Remember our new nursing bill, okay? The focus of our new nursing bill, which we prayed and hopefully will become our new nursing law, okay? We have already in place the advanced practice nursing in the country. Okay, so that is good news in for all of us, my fellow nurses. Okay, so these CPD credit units could really help you a lot. So please keep those credentials. You need those credentials. You need those certificates, okay, in the future, okay, for the credit accumulation and transfer of your CPD units, okay, to career progression and specialization, okay, into advanced practice nursing, okay. Next slide, please, fellow nurses. Okay. So the challenge now that we are facing, my fellow nurses, is this, okay, to make the necessary investment in human capital for health and understanding that health workers, such as nurses, are vital to health of communities and economic prosperity. So this was made known by the report of the State of the World's Nursing 2020 by the International Council of Nurses, that there is really a call to invest on our human resource, to invest on our nursing staff, okay, because our nursing staff really could really make a difference into the health and into the economic prosperity of our community and country and the world in general. Okay, next slide, please. I'm almost done, my fellow nurses. Okay, so I would like to reiterate to you, or I would like to read to you the message of Miss Annette Kennedy, the current president of the International Council of Nurses, with regard to us nurses. Okay, remember we just celebrated last May 12, the International Nurses Day, and we believe that the month of May is actually the Nurses Month. Okay. Now, May 12 is the birthday of the founder of modern nursing, Florence Nightingale, okay? Now, according to Annette Kennedy, quote unquote, I know we will still have challenges, but we can surmount those challenges. We can work together to build a better future for nurses and patients. Each one of us can make a difference, but together, the 27 million nurses can change the world. And in 2021, we start to see the change. The future is into our hands, my fellow nurses, okay? So as I've said, there is no time to really move backward, but this is a time to really move forward. Now that something good will really be for all of us, my fellow nurses, especially in investing, okay, a safe and effective nursing workforce through continuing professional development programs. Okay, so I would like to end my talk. Next slide, please. Okay, nursing is great for so many reasons, but there is still one reason that means more than any poll results. Amount of money or job security with nurses make a difference. This is according to Brittany Wilson. Okay, so we never stop ourselves from making a difference because, okay, so they say, save one life, you are a hero. Save 100 lives, you are a nurse. So this is my very important message to all of you, my fellow nurses, especially to our frontliners, okay? So on behalf of the PR Board of Nursing, headed by our chair, Honorable LCT, greetings to all of you. Happy International Nurses Day. Okay, I would like, okay, we have no names in here, but I would like to mention each of the member of the PR Board of Nursing. To the left, we have Honorable Carmelita Divina Gracia. Okay, then we have Honorable Zenaida Gagno. Okay, both of them from the NCR. Then we have Honorable Mary Loong from Cebu City. Then our chair in the middle, Honorable LCT from Davao City. Then we have yours truly from Region 6, in particular from Negros Occidental. Then we have Honorable Elizabeth Lagrito from Cagayan de Oro City. And then at the farthest end, Honorable Carfredo Dumlao of the NCR. Okay, so this is our message to all of you. As a nurse, we have the opportunity to heal the mind, soul, heart, and body of our patients. They may forget your name, but they will never forget how you made him feel, okay? So this is our very important message to all of you, especially our frontliners. We pray for you every day. We appreciate all your hardships, your sacrifices. We really salute and commend you, okay, to the point of risking your lives. You keep on fighting our unseen enemies. Okay, sometimes risking your families or even your own life and health. Okay, so please have the stamina. Keep on praying. We also pray for you, my fellow nurses, and our snappy salute to all of you. Please don't stop, okay, serving, because that is the call of our duty. Okay, then I would like to end by saying, mabuhay ang PNA Region 6, mabuhay ang PNA Antique for really being bold to host this virtual summer conference 2021. Mabuhay si Governor Lea Alayon, all the regional council members, chapter presidents, whom I worked with closely during my governorship time from 2015 to 2018. I love all of you, and to all my fellow nurses, Luzon, Visayas, Mindanao, and across the globe, thank you to all of you. God bless us all. Mabuhay tayong lahat. Filipino nurses, the best for Filipinos and the choice of the world. Thank you, and God bless us all.
And mabuhay rin po kayo, Dr. Merly, and thank you very much for that wonderful and inspiring talk. Indeed, a properly resourced, educated, and valued nursing workforce can enhance the health and well-being of everybody in the planet. Thank you very much again, Dr. Merly. With this, again, we would like to award a certificate of appreciation to our plenary speaker. The certificate reads, Certificate of Appreciation is awarded to Honorable Merly L. Salvani for her valuable involvement as plenary speaker on the topic Investing in a Safe and Effective Workforce, Continuing Professional Development for Nurses in the Philippines. Don't worry, there are a lot of questions regarding CED, which will be asked later in the interactive discussion. We would like to remind our participants, especially to those who type in their questions in the comment section. Kindly, please send your questions in the Q&A box. We'll only read the questions which were sent in the Q&A box. So in a while, we will be reading all of these questions. Once again, thank you very much, Honorable Merly L. Salvani. And that concludes plenary session number 4, and we proceed with our 5th and final plenary session for this conference. Ladies and gentlemen, please allow me to introduce our next speaker. Our next speaker is a nurse in 6th West Visayas State University Medical Center. Formerly, he was the Chief Patient Services Officer and Director of Nursing at the Medical City Iloilo. A Board of Director, Auditor of the Philippine Nurses Association Iloilo Chapter, a Board of Director, Association of Nursing Service Administrators of the Philippines Incorporated Iloilo Chapter, member of Sigma Theta Tau, an Honor Society of Nursing, member of Delta Nursing IT and the Philippine College of Hospital University, Ladies and gentlemen, our speaker for plenary session number 5, a big round of applause please for Mr. Joaquin Isapol. Mr. Joaquin, take it away.
Hi, Joffred. Thank you. I can still hear the I can still hear the background music. There you have it. So please let me know if you could clearly see my presentation and if you could hear me well.
Yes, sir, Jake. Please go ahead.
Sige. I would like to first say thank you because this is again another opportunity for us in the profession of nursing to gather virtually. This might be something that is new, but PNA activities have always been close to my heart. And I would like to personally say my thank you to the PNA National, also PNA Region 6 Council, along with its leaders, to Governor Dr. Alayon, also to PNA Antique. Sir Aris, thank you very much. And of course, I would like also to acknowledge St. Anthony's College in Antique. So I know there are a lot of colleagues here, as much as I would want to acknowledge and call you one by one, but I would like to address you universally. And thank you so much for joining us for today's session. I am tasked actually to talk about the image of nursing. And I was given, based on the invitation, an hour and 30 minutes to do this lecture or to do this presentation. But then last night, segue lang, I tried to do a rehearsal and umabot ako ng almost 1 hour and 25 minutes. So I told myself, baka kailangan kong i-cut some of my discussions and the presentations so that we will not go beyond the time limit. But nevertheless, rest assured that what we shall be discussing now is something that will not cause difficulty or discomfort to everyone, because this is a very basic yet significant and relevant topic that we shall be discussing, and we shall be talking about image of nursing. Yeah, allow me to provide the disclosure, although I was introduced already a while ago. I am a part-time faculty of Central Philippine University School of Graduate Studies and a full-time employee of West Visayas State University Medical Center. I am also a board of director of Philippine Nurses Association Region 6, and at the same time of Association of Nursing Service Administrator of the Philippines here in Region 6. And I am not in any way engaged in other salaried teaching or professorial activities or collaboration, other the things that I have mentioned to you a while ago. For today, I shall be discussing about image of nursing, but based on the invitation, I will concentrate on these two objectives. We shall be describing the ways to promote a positive nursing image, both in our workplace, the place where we are working, and at the same time to the public. This is quite interesting because we will see later on as I progress with my presentation as to our own perception as what our image is, and at the same time versus the perception of the people that surround us. And second objective would be to, we are going to enumerate and at the same time identify actions that we could actually do, not just individually, but as a collective approach to improve, but other than improve, to sustain and to safeguard our image of nursing, the professional image of nursing. But then our session for this morning also will concern about the interplay between public and personal image, and offers tactics that we can use to promote the image of nursing, be it at work, home, and in the community. Actually, my topic now is I was glad and happy because given the speakers who were able to successfully present their topics, it would be easier for me to walk you through with my discussion, because some of the topics have also been discussed. But at the same time, I will not jump directly to the core of my presentation for this morning. I divided my presentation into two parts. The first part would be a preliminary. So I shall be walking through you to specific areas, critical areas that we could not take for granted. And at the same time, on the part two of my presentation would be the core of my lecture, which shall concentrate on the image of nursing itself. So, and I want you to make a connection as to how I'm going to walk you through or transition you from the preliminary discussions and things that we shall be discussing and seeing in my slides. And when we apply that in the core or the body of this morning's discussion, when I talk about the professional image of nursing. But then let's try to first understand what do we mean of safe and effective workplace. Safe, it's something that there is freedom from harm for both the healthcare workers and at the same time, our families and patients. So if we have workplace safety, occupational safety, alongside it, we also have patient safety. So I am defining safety in the workplace, but I could not get rid of the partners of healthcare workers, and that would be our clienteles, be it in the individual level, family, or community level. They are our patients, they are our clients, and they also deserve a certain degree of safety. That's why when I shall be discussing workplace safety, I could not detach myself from patient safety or community safety in a larger context. And when we talk about effective workplace, it's all about the provision of positive environment of work for healthcare workers and environment of health and healing for patients and families. Effective workplace is more of the outcomes, and there is already a translation of the things that we do in such a way that we could feel, see, and sense tangible outcomes of how we do things inside our workplace. But one of the key aspects of scrutinizing or understanding effective workplace is by how we take a look on the major resource of any organization, and that would be its human capital. An effective workplace is said to be effective if it gives premium to the healthcare workers, if we are talking about the healthcare industry. In the Philippines, we are fully aware of this, that we have been guided by the occupational safety and health. And this situation where we are right now is really a trying time while we are facing this contagion. While we are trying to strategize things and how we're going to address or manage this pandemic or COVID-19, we are also doing this not just to ensure that we are in compliance with the guidelines of the agencies or regulatory bodies. We are doing this because we want to safeguard the welfare of the employees. And if it's in the hospital, it's about the safety and welfare of the people working in a specific area of practice. And if you would allow me to to go back, siguro mga 5 or 10 years ago, when we talk about occupational safety and health, the thinking was that for private lang naman yan sila strict eh. But then safety is universal, and when we're talking about workplace safety, walang exemption yan. That is why it was released in March of last year, 2020, this joint circular by the Civil Service Commission, COA, and DBM with the subject Occupational Safety and Health Standards for Public Sector. So ibig sabihin, hindi lang private sector ang minomonitor or nire-regulate or ina-assess as regards to our compliance to to workplace safety as per OSH, kundi pati na rin tayo that we are working in the government or public sector. And this is a good move to really communicate a language that when we talk about workplace safety, it's universal. And kaya nga tayo we have this universal healthcare because walang pili yan. Ibig sabihin, it's for all. And regardless if you are in a private or government sector, when we talk about workplace safety, lahat kasama dyan. This one is also workplace safety in relation to patient safety. I mentioned a while ago that when I'm trying to discuss things about how we're going to safeguard our workforce, our employees, our frontliners, our nurses, I could not detach from thinking that we should also be taking care of our patients. And what you can see now in my slide is one initiative that is really relevant, this Patient Safety Moonshot. This is actually a project by the Patient Safety Movement, and based on their annual report in 2020, it says there, 0 because 1 is too many. Tama nga naman, di ba? If we are going to identify or define specific indicators or elements when we talk about safety, both in the workplace and with our patients, hindi pwedeng maglalagay ka ng window na magkakaroon ng error. Why target for zero tolerance? That's why we have been hearing zero tolerance to patient harm, like zero tolerance to needle stick injury, for example, to falls, medication error, and so on and so forth. Because 1 is too many. And we are doing this because we want to safeguard both our patients and our healthcare workers. And this is a good move for the patient safety movement when they launched their patient safety moonshot. It's called a patient safety moonshot because if you try to imagine a space rocket being launched outer space, when you are up there, isa ka sa mga astronauts, for example, isa ka sa mga mapalad na passengers who would be there to join the mission. When you are there outside space, you would be able to see clearly and holistically the entirety of the planet Earth. And when we relate that to patient safety, ibig sabihin, if we support this movement, the thrust is directed towards ensuring that we set a goal or target for patient safety, not just for a specific country, specific region, but also for everyone. How about when we talk about effective workplace in general? So I got a snippet from the Strategic Human Resource Management's Effective Workplace Index, and they identified 7 components of an effective workplace. You can see here in my slide that these components actually are really human sensitive, meaning it's usually geared towards building our people. Number 1 would be job challenge and learning opportunities. If you keep on doing things in your workplace, paulit-ulit, it becomes boring. And given the fact that our workforce diversity now is really obviously makikita natin may Gen Z ka na, may millennials ka. If you set a workplace that would promote a working environment na parang stable, walang challenge, these people or these healthcare workers would just say, ayoko na, gusto ko na, parang gusto ko iba naman. And that's normal because that's the pacing that our younger generations are experiencing right now. And when we talk about learning opportunities, pag nakita niya na walang opportunity to grow, I keep on doing things again and again. I'm comfortable with my day-to-day tasks, walang challenge, and that compromises the entirety of the effectiveness of our workplace. Second would be as regards to providing support to our coworkers. And this is actually related to number 7, wherein if we have support provision for our coworkers, there also has to be supervisory support to ensure that we achieve job success in our workplace. And I'm glad that the Dr. Jerial a while ago was able to mention that hey, we should never underestimate the roles of the nurse managers or supervisors, those who are situated in the middle of the organization. Di ba meron tayong rank and file, the middle management, and the top management. Let us not take for granted those who are situated in the middle, because these persons in the middle are very pivotal in the implementation cascade of the strategies and goals down there, from up there, down there. And at the same time, they serve as mediators from the things that they know, they see, and they feel from down there going up there. So tama lang naman that we have to acknowledge the role of the middle managers or middle management as regards to ensuring effective workplace. And same thing goes also with our colleagues or co-workers. Dapat ang support ay hindi nawawala, because no man is an island. At ang laban na ito that we're facing in times of COVID, for example, is not just a one-man show. It requires collective effort. Another component here is about autonomy. Ibig sabihin, you have the ability to decide or have input into what you do, and you have this trust, you have this accountability and the responsibility to do things, because you are given the authority and at the same time the freedom to do the things that you should do to safeguard your workplace and your workforce. Another thing would that be work-life balance or work-life fit, as they may call it. Simple lang, where we are right now is really challenging. Mental health, it's very crucial. And if we do not maintain a balance between the work that we do and our life outside our workplace, pag walang balance, very challenging yan. And it could impact both our performance and at the same time, our internal peace na tinatawag natin. And another thing would be satisfaction. It's mentioned here in the slide that there's a certain thing that we should provide in order to motivate our people, our colleagues, our co-nurses, be it in the form of wages, benefits, and opportunities to advance. But mind you, when we motivate others, we are not only considering about all these things that I have mentioned. Motivating or ensuring patient satisfaction can be driven both tangibly and intangibly. So both salaries and benefits that I have mentioned, and at the same time, even moral support, are very pivotal in ensuring that we safeguard and we work on with the satisfaction of our workplace and at the same time of our workforce. And last but not the least, of course, is this culture of respect, trust, and belonging. These trying times, we have to make and we have to move by making strategies, ensuring that we are a family. No one shall be left behind, and we are all in this together, ika nga sabi nila. So why am I discussing all these things? No? Ano bang relationship nito when I'll be talking about the image of nursing? Our professional and personal image. Because if we fail to address safety in the workplace and at the same time, effectiveness in the workplace, baka we keep on trying to question why we are being seen on the outside by the public, opposite to how we feel and how we perceive about who and what we really are as nurses. Most probably, if we do the whys, if we ask the whys, and if we do the root cause analysis of the things that we do, we will be shocked that the reason that there is a change or discrepancy or variance in public perception, most probably because sa una pa lang, we failed to acknowledge that deep within us, we have a challenge to face from where we are working and from where we are actually existing on a day-to-day basis. When we talk about effective workplace in nursing, you can see here that according to the American Association for Critical Care Nurses in 2016, nag-identify sila ng 6 foundations for healthy work environment. So defining effective workplace can also be translated into ensuring or seeing that indeed there is a healthy work environment. And naka-enumerate dito yung tinatawag na scaled communication, meaning you have the proficiency to translate the things that you know to the words that you have to utter going to the receiver, and a feedback, of course. Next is true collaboration. We gone are the days that we are existing on our own. Ika nga, no, sabi nila, if we exist in silos, wala tayong papatunguhan. All we have to do is to collaborate and work interdependently. And at the same time, there has to be interconnectedness in the division, not just within nursing service, for example, but also in the entirety of the organization. Next would be effective decision making. When you do decisions or when you make decisions, especially these trying times, you have to be careful. Now, you are making this decision not only for the benefit of the selected few, but it should be for everyone, for everybody. And this is a challenge for us to really gauge how effective our decision making really is. Next would be appropriate staffing. I want to divert you, my dear nurses, to taking a closer look when you hear the word or when you see the word staffing to number of nurses. Because the truth is, there is more to that. Pag sinasabing staffing, sometimes sabi natin, ay naku, ratio yan. Kulang sa manpower, walang approval ng actual versus the approved plantilla or manpower count. It goes beyond that. It's implied actually na that we tend to count when we talk about appropriate staffing. But one crucial thing when we are dealing with staffing is this thing that we call job matching. Match. When we match, it has a relationship to staffing. Are we putting the right person or the right professional to a specific job deliverables? Or maybe we're just allocating individuals or persons to a specific position with possible duplication of tasks. So makikita natin dito that the appropriateness of staffing is actually going beyond counting the number of people in the organization, but rather we have to take a look on the sets of competencies, the skills that our colleagues, for example, are manifesting. Baguhan ba yan? Is he or she a novice nurse? Is he or she a tenured? How about the skills mix? How about the appropriateness of his or her expertise or his capacity to deliver a specific outcome? Dapat tinitingnan din natin yan. Next would be meaningful recognition. Sa panahon ngayon, recognizing, inspiring, motivating, and acknowledging a person matters a lot. And it goes farther if we recognize the person for his or her efforts. Hindi naman kailangan na that person or that nurse would have to work tremendously for you to acknowledge him or her. As a nurse manager or bilang isang colleague na lang, no, to establish the ground, we are not excused to provide recognitions to our colleagues. Even nga self-recognition, we could recognize ourselves for a job well done. Hindi kailangan maghanap ng somebody else to do the recognition. But then the recognition has to be meaningful, wherein you cite, you identify clearly kung ano yung strength niya, and at the same time, you do an element of coaching and mentoring, and this has been mentioned by our previous speaker a while ago. And last but not the least, of course, is leadership that is authentic. So I will not discuss here the specific leadership style that you're going to portray these times of pandemic or crisis. My premise here is, regardless of your leadership style, I want to challenge you if indeed the kind of leadership that you are manifesting is something that is authentic, original, and imperative of what the healthcare workforce and the healthcare as a whole is really demanding from us. So kahit anong klaseng leadership style ang meron ka, for as long as it's actually purpose-driven, you have the intention, and it goes beyond selfish motives, then go for it. And you have to be sincere when you are manifesting and putting into action your leadership expertise or leadership skills and abilities. Yesterday, one of our speakers, Dr. Annabel Borromeo, mentioned about the Philippine healthcare system. And it's good that I was able to prepare this slide because I shall be discussing briefly about the complexity of the healthcare system, specifically here in the Philippines. As you can see here in my figure, you could see dots in blue and at the same time small squares in red. There are also lines. the dots and the squares connect, some of them intersect, and it's very chaotic. Sometimes it's hard for us to identify where's the beginning and where's the end. And this is how we try to define or describe our healthcare system, not because we are so critical about the healthcare system, but we are appreciative of the complexity of the healthcare system. And in 2018, according to Dairit et al., they issued this article about the Philippine health system. And this is actually a review of what the healthcare system looks like. And it tackled on the specific components as to organization and governance. That's about structure, how we do things, policy development. Next would be financing. It's about fundings, physical and human resource, the human capital, provision of services, health reforms, primarily the principal health reforms, and health system assessment and monitoring. So if we take a look on these 6 major components, hindi ito simple lang. These things are very critical and it takes a lot of rational and logical understanding if we want to put that into context. Now, baka nagtatanong kayo, why is Jake discussing all these things? Again, same response. If we want to fully understand our own image as professional nursing, we have to go back a little bit and take a look on our environment. Ika nga, no, in strategic management process, you are considering environmental scanning, be it internally or externally. And failure to get an understanding of what is happening around you, sometimes makaka-affect yan on how you perceive yourself as a nurse professional. And sometimes you will just keep on asking why the public or why the people is trying to interpret us like this and like that. And sometimes masasagot natin yan if we go back to the things that influence us in the very first place. And this is the reason why I was trying to walk you through on these specific aspects in this morning's discussion. One more thing also is about the International Code of Nursing, Code of Ethics for the ICN Code of Ethics for Nurses. And if you recite the preamble of the ICN Code of Ethics, it says there that the nurses, we have a fundamental responsibility as regards to health promotion, prevention of illness, restoration of health, and alleviation of suffering. And the need for nursing is said to be universal. I will not be talking about the elements of the code as regards to nurses to people, nurses to practice, nurses to profession, and nurses to workforce. But what I will share to you based on this slide right now is something that is really interesting and exciting. Because last year, October 21st of 2020, the International Council of Nurses launched a consultation to revise the Code of Ethics for Nurses. And it was in a month after, in November of 2020, when they tried to consolidate the findings of the consultation. And it was posted that this year, if not during the month of the International Nurses celebration, in the first 2 or 3rd quarter, the ICN will be issuing the revised ICN Code of Ethics for Nursing. And maybe we will ask ourselves why. It says there, we are considered as one of the most trusted professions in the world, and nursing is held to a high standard. The world demands something that is best from us nurses, and that's how they see us. And that's according also to the CEO of the ICN, Howard Caron. And also, given the things that have been happening around us, industrial revolution, the changing of technologies mean we have to make choices we didn't have to make before, and even social justice. I know that when we talk about social justice, marami tayong mga baggages. Siguro if I will invite you to have a cup of coffee and we talk about ano ba yung mga social justices or social issues that beset or pumapaikot sa profession ng nursing, for sure marami tayong pag-uusapan and ang dami. And given this, the ICN actually saw that there is a need to revisit our code of ethics because of these very challenging situations, from the fight against pandemic, fight against the discrimination, and of course, championing for human rights. And let's see kung ma-release na nila or may issue na nila, because I myself is also very excited to see kung ano yung mga significant changes na yon. But that's a normal course. If we foresee where we are headed right now in the next 30 years, 50 or 100 years, more so with our code of ethics, because our environment is constantly changing. And what we do before might not be relevant or sensitive to the things that we should be doing now and in the coming years. So the big question here is, so what would be our commitment to our patients that we serve? It says they're world's best nurse. Best nurse dahil gusto nila that we shall be treating them, we should be addressing them as regards to their needs, provide them explanations, be with them, watch over them. And dapat pag tinawag ka ng isang patient, you have to be there because may turnaround time. And hinahanap tayo ng mga patients natin. And that's what they demand from us, because that's what they see. That's what they know about us, that we as nurses, we should be delivering those services to them. And that's why I pasted it here, that they're actually looking for the best nurse because they do not deserve a second best. But I want to highlight that more than being the best nurse that we can, why not challenge ourselves to be the safest nurse? The safest nurse that focuses not just on mastering the things that we do from assessment to evaluation or to the execution of the nursing process, but as regards to embodiment of who we are as professional nurses, both inside and outside where we're working. And that's about our roles in the society when I talk about total societal impact of nursing. We are the best and we are the safest nurses, and that's our challenge, a challenge to us. But the public and the people around us, the community, the society also demand the same. And it's really, really challenging because tinitingnan tayo as elements who would provide care to our patients regardless of all walks of life, ensuring that we deliver what is expected for them. And the standard is always very high. Allow me also to walk you through with the NCCS, because I could not get rid of discussing education, nursing academy, nursing education, when we talk about nursing practice. And this conceptual framework that we could see is a language. This is a language that this is actually who we are and who we nurses should be here in the Philippines. It defines here our role as client care or care provider, as manager and as leader, and at the same time, our role in research, alongside with the responsibilities and core competencies and performance indicators. And you can see that the arrows are pointing at the center, at the core of this framework. We are doing this, therefore, not just to say that I am a good nurse, I am a safe nurse, I am the best nurse, I am a versatile nurse. No, it goes beyond that, because we have to measure our competencies beyond our own selves. And that can be translated and manifested by what our patients experience, what the individuals, the families, and the population groups can experience given all our competencies. So now, why am I again discussing all these sets of competencies? Because the public is expecting us to provide care and to be who and what we are based on the competencies that they demand from us. So now, slowly, makikita natin that maybe the reason why we are interpreted or misinterpreted, because the public most probably ay hindi pa fully naiintindihan kung ano ba talaga yung kabuuhan, the uniqueness and the peculiarity or even the complexity of who we really are as professional nurses in the love and service to our country as nurses and healthcare workers. Every year in the United States, nagkakaroon yan ng Gallup poll or survey. And this study or survey is being conducted among roughly 23 professions. And we have to rejoice because when we talk about the H and the E of nurses, it's about the honesty and the ethics of nurses. Parati tayong nasa top. And for the past 2 decades, almost 20 years, nurses ang laging pinakamataas. If we survey the public, kung sino yung pinaka-honest and pinaka-ethical na professional, parating sinasabi ay nurses. And with that, kudos, because they see who and what we really are on the context of trustworthiness. Because this is a measure of the public trust to us nurses on the lens of honesty and ethics. However, this is the reality. Even though we are on the top of the survey, meron pa rin mga negative stereotypes for nurses. Yung iba sinasabi na ang mga nurses ay parang mga battle axes. Physicians, handmaidens, airheads, kaya parang balloon yung nilagay ko dyan, no? Airheads, I have to search it online, parang floating, walang common sense, and a lot more. And worse there is, ginagamit tayo sometimes as a symbol of the 3-letter word, sex, sex object. And that's the reality. Hindi natin pwedeng takpan ang mga ears natin because we have been experiencing all these stereotypes around us. And yes, there is still a dichotomy between trustworthiness and these negative stereotypes. Mararamdaman natin ito, makikita natin ito, and we could not just cover up our eyes or close our ears on these stereotypes. Because if we will not address this, it would impact the negative image of our profession if we will not do something about it. And maybe 5 or 10 years ago, although hindi ako mahilig sa activity na to, makikita ninyo, perhaps some of you here, no, na attending this webinar, nakapag-watch kayo ng mga TV series that depicted nurses. Nursing that represents nurses that represented a specific persona or personality in front of the television. I will not name those TV series, but I would like to concentrate on the portrayal of the behavior. Ang dami dun. Yung iba dun sa kanila ay autocratic, parang nakakatakot, parang let's say it gives an image na ganyan pala yung mga nurses. Ganyan pala yung relationship ng mga nurses. Ganyan pala ang kalakaran ng mga nurses inside the hospital or even up to their personal lives. Because that's what the public see as regards to this media, internet, movies, television, pagbabasa ng libro, reading materials, or even with the use of greeting cards. And nakikita din natin yan as nurses themselves. These things are happening around us and we could not run away from it unless we do something to address all these stereotypes na nag-i-engulf sa ating mga profession or sa ating profession. And this was mentioned and presented yesterday by President Melbert, yung mga specific stereotypes na to. Yan, this one is an example and this one. So sabi ko kahapon, what President Melbert is presenting is parang magkapareho din to, sa mga ipapresent ko on the next day. Kaya sabi ko, I'm not going to delete it, but still I'm going to present it. But I'm not going to talk about it deeply. Kasi it's very clear. It's very clear that our boats are being shaken when we see these things. And we denounce these things. Because we are fully aware that we are not like that. We do not act this way. But then nakikita natin yung difference. It's always about what we know about who and what we really are. But how about the people, the public that perceive us? There is that discrepancy and variance between 2 points. Tayong mga nurses and the people that surround us. And this one, now let's go to the core of my discussion, the part 2. We are discussing here, or we shall be discussing here about the link. Now, itry na nating pagtagpiin between public and personal image. And as you can see here, on the left side of my slide, this is us, tayong mga nurses, aware tayo that we are saving lives. We love our patients. We care for our patients. We commit to serving our patients, serving our country, and the entirety of this world and this nation, or even the universe. But the question there is the public seeing, feeling, and acknowledging that? Perhaps some would say yes, and others may answer no. But it says here, the public image of nursing includes how the media portray us and how the public perceives us. With the advent of the access to media sources nowadays, ang bilis ng mga bagay-bagay. Pag may mga issues or concern na nangyayari sa hospital, lumalabas ito, and these things are being sensationalized. And ano ba usually ang nakikita ng public? Our side ba? Or kung ano yung nag-formulate sa mental models nila? Kasi yan yung nakuha nila. And that's what they saw, what they felt, and what they have observed. And we are placed in a scenario wherein it's really challenging. Ano ba dapat gawin natin? Because we are misconstrued, we are misinterpreted, be it small gestures natin, big gestures natin, nakikita ng public. And there is a variance in terms of processing by the media and processing of the public. And these things are very obvious. It says here in an article that was a paper in 2014, one study concluded that the public image of nursing is diverse and at the same time incongruous. The authors of this study noted that image is partly self-created by nurses due to their invisibility and lack of public dialogue. 2014 yan. Sabi nila, hindi naman kasi tayo nakikita, hindi naman tayo naririnig, takot naman tayong magsalita, tago lang tayo ng tago. So what do we expect? Tayo din naman daw yung nag-create ng self-created image natin because we kept on hiding. But now, I personally could see that things are starting to transform and to change. Nurses nowadays, specifically Filipino nurses, we are giving premium to our voices. And ika nga, sa team natin, we are the voices to lead. And I am so happy to see that from those spaces or those times or moments na parang nakabusal tayo, here we are right now. We are stronger, we are confident, we are bold because nakikita natin that we are working as a group, working collectively and hindi individually. Another example here that was mentioned by Streisand Lian in 1992, sabi niya, there is actually a model that would link our thoughts and beliefs to action. Ito naman yung major challenge sa ating mga nurses. If we want to appear who and what we really are in the public. Magaling tayo kasi sa pag-iisip that I am a nurse, ang daling sabihin, I am a nurse, I commit to doing my oath, I commit to delivering what is expected of me. But then how about the translation of the things that we do? Pag andyan ka sa nurse's station, lahat ng principles ina-apply. But then when we go to the point of care, umiiba. There is a change na nangyayari. So nag-shift tayo. That's why what we know, what we feel, what we process sa ating thoughts ay hindi sometimes na-translate sa actions natin. And these things are also happening and we need to understand the reason behind. As an example, Sinabi dito, nurses who see themselves as professionals will be strong advocates for patients. And patients experience this advocacy and remember it when talking with others. This simple conversation contributes to the overall public image of nursing, which in turn improves the nurse's self-image. So dapat may translation. May translation kung anong pinaprocess natin sa mind, dapat nakikita yan sa action. Because the public or the people around us, the society, the community will not be able to read what's inside our minds and our brains. Anong nakikita nila? Our behavior, our gestures, how we behave, nakikita nila yan. And it's a challenge for us. And this model is really good. When Strayson mentioned about this link between our thoughts and beliefs with our actions. Another example is in the academe naman. I'm an educator, and nursing education is something that is also close to my heart. We are in the process of ensuring that we are producing and preparing the next generation of nurses who will be taking care and be continuing with our oath and commitment to the people and the community that we serve. Developing the nursing image, it says here in 2017, according to the authors, begins with exploring how nursing students view themselves and the profession. That is why when we are trying to leverage the education of the nursing students, we have to be critical in ensuring that indeed there is this thing that we call role modeling. More than the theories, the concepts, the things that we're trying to introduce into the minds of these future nurses, we also have to ensure that they would be able to appreciate kung ano ba talaga yung tinatawag na professional modeling in nursing. Dapat makikita nila yan because sometimes that could make or break them in the process of building themselves from being a student nurse to being a soon-to-be a full-fledged nurse. So very challenging. And in one study here, it says na students who were related to a nurse, be it by blood, kamag-anak, or friends, colleagues mo, comrades, were more likely to carry a positive image of nursing. And most students, based on this study, who started with positive image of nursing, reported professional success and satisfaction. So now, the question here is, who is responsible? Diniscuss din ito yesterday ng ating mga esteemed speakers. And the answer here is, we have the Nightingale's Pledge. And it says there, we committed to this, that we will do in all our power to maintain and elevate the standard of our profession. And this has been further supported by a stronger statement from ANA, Code of Ethics for Nurses, that states, the profession of nursing as represented by associations and their members is responsible for articulating nursing values, maintaining integrity of the profession and its practice, and for shaping the social policy. And moreover, according to the Filipino Code of Ethics na diniscussed din also or cited by Sir Melbert yesterday, specifically in Article 5, Section 15, it says there that we, registered nurses, must project an image that will uplift the profession at all times. Take note, at all times. Walang excuses yan. And this is a challenge to all of us. More than we improve, we capacitate and enhance ourselves in being expert clinicians, educators, public health workers in terms of the specific tasks that we do, wag naman nating kalimutan yung professional commitment natin as regards to our ethics in upholding our professional image. And here, there's an icon here about a silenced icon, no, na parang nakamute siya, going towards with an arrow in green, and it says nurses, a voice to lead. And you could not be able to take part in this advocacy of leading, transforming, and reforming if you do not have the voice. Kaya never underestimate your capacity to express yourself. in a professional context, of course, within the boundaries of ethics and morals. Kasi importante din yan. Hindi yung salita lang tayo ng salita without anchoring what we say and what we do on specific ethical and moral standards. And it says here, according to the author, Gordon and the Buresh, in 2006, From Silence to Voice, What Nurses Know and Must Communicate to the Public, nag-recommend siya ng 3 tiers for public communication. It should start from professional self-presentation. Ibig sabihin, you expose that you are a nurse, I am a nurse. This is me, and this is the entirety of my personality. I worked hard for this, and I value who and what I am as a professional nurse. Then you go on to this anecdotal description of nursing work. This is what I do. Ito yung ginagawa namin inside the hospital. As a nurse educator, ito yung ginagawa ko in school. And as a public health nurse, this is what I do when I'm in the community, in the service of the public. We have to communicate and to let them know the things that we have been doing. Hindi pwede na ang ginagawa natin ay tayo lang yung nakakaalam. They could see us, but there's no harm if we use our voice in communicating what we do as regards to our beloved nursing profession. And third would be the use of mass media. If you want to go universal, global, with massive reach, ika nga, when we talk about marketing, it says here television, newspapers, radio, YouTube, blogs, Facebook, Twitter, IG, and so on and so forth. And I'm so glad that yesterday, one of our speakers, Dr. Annabel Borromeo, mentioned that she has a YouTube channel, and I'm actually one of her subscribers. And that's one of the things that we could do if we want to make our voices heard as our nurses. Rather than ranting, rather than making boisterous and creating loud noises that do not embody the image of nursing, of course, we do have the right to do that. But let us concentrate on building upon our profession as nurse by using these platforms to promote the image of nursing. Telling the people, these are the things that we do, these are our contributions, and these are our roles in the society. And this, we would actually feel that we could impact tremendously in challenging how the public or how the media perceive who and what we really are as nurses in this noble profession. One challenge involves the differing perceptions about what constitutes, quote-unquote, good. So ano ba talaga gusto natin? Tawagin tayong, this is just an example without prejudice, no? To certain tags na tinatawag sa nurses. Let's take this as an example. And sinabi here in the slide na tinatawag tayong nurses. Now, the question there is, if somebody would think na, ay, the nurses and the angels are coming. They're walking towards us. The question there is it helpful or hurtful? For some, maybe yes. For some, maybe, I'm not comfortable. But let's try to be fair. Let's take it on both sides. There will be people who will appreciate that, but there will be others who will not appreciate that. But according to the author, it says here that ano ba talaga yung gusto natin as an image, to be seen as nurses or to be seen as an angel? So ang question na yan ay kailangan nating namnamin. Ano ba talagang gusto natin? Although these are just tags, these are just labels. But you know, when we do not address tags or labels, it becomes a habit and it becomes a norm. Magiging normal na yan. And baka babibigla na lang tayo balang araw. Instead na sasabihin ng pasyente, nurse, I need you. Sasabihin niya, angel, I need you. Funny, I'm just funny as I may appear, but that's a possibility because we are trying to allow things that we shall be called in such way that they will call us as such and not as nurses. And why not, rather than tagging nurses as quote unquote angels, heroes, superheroes, so on and so forth, why not, we nurses utilize evidence-based practice. He or she is a nurse that utilizes evidence-based practice. This is a challenge to each and every one of us. So now, let's go to specific actions that what we should do hindi bukas, kundi today. What we're going to do, I have enumerated here 10 actions, and I got these actions from an online course, and let's walk you through one by one. Number 1, identify yourself as a nurse. When you identify yourself as a nurse, and when you enter a patient's room, for example, wag mong sabihin na, "Hi, good morning, kumusta?" Then you go directly to checking the IV site, the IV lines, and so on and so forth. Nagiging busy ka na sa pag-address ng mga nursing tasks mo. But based on this action, when you identify yourself as a nurse, dapat kumpleto. Hello, good morning. My name is Joaquin Sapol Jr. I am a nurse. I will be your nurse from 7 a.m. until 7 p.m. or depende sa kung ano yung shift mo. And you know, I am very happy to be of service sa'yo. Yun, simple lang naman yun, di ba? And how come that sometimes we tend to observe na parang hindi na natin narinig yung mga ganong bagay? Good for those who uphold that they are a registered nurse. Nurse po ako whenever they talk. Or for example, to the public, it will not kill us if we tell them that I am so on and so forth and I am a nurse. Parating nating idudugtong yan that we are a nurse. Because it's one way of letting them know that we are proud of who we are, bearing this 2-letter abbreviation as professionals. We are registered nurses. Number 2, join professional nursing associations. It can be Philippine Nurses Association, ANSAP, Specialty Association, etc. Ang dami niyan. And Ma'am Merly mentioned a while ago kung ano yung mga associations, no? Like aside from CPD, mga associations niyan sila or bodies that actually work hand in hand to uplifting the image and the profession, our beloved nursing profession. In the US, when we talk about associations, behaviors, and media, meron silang the truth about nursing na parang body that monitors the image of nursing. And it says here that ideally, you should join more than one association. But my take here is this. If your intention to join an organization or association is just to say or to tell yourself that, yes, ang dami kong association na member ako. Member ako ng ganito, and you keep on telling people that you're a member of a specific organization. But then if you do not fully understand your role, your calling, your commitment, why you join such organization, then it becomes irrelevant. Nawawala yung saysay. Nawawala yung essence na why you join that said association. Why not convince ourselves that we are joining a specific association organization because I have a bigger role to play outside my workplace. I have a stronger role in the society in safeguarding the welfare of my colleagues, the healthcare system, and so on and so forth. Hindi yung parang you keep on joining just for the sake of aesthetic value. Hindi dapat ganyan. Dapat if somebody will ask you, are you a member of a specific organization? Dapat yung sagot mo hindi lang yes or no. Dapat automatic. We are doing these things. Ito yung responsibility ko. And these are our commitment, and this is our promise and our commitment to the public and to the organization. Let's go beyond collecting or parang namamakyaw ka lang ng organization na sasamahan mo. Dapat may outcome ka, dapat alam mo kung ano yung pinasukan mo. And that's one way of identifying specific actions in promoting our image of nursing. For the past year, I have seen and I have felt how PNA, for example, allow me to use PNA, no, because I'm also a member of PNA. I have seen how PNA worked hard in gathering professional nurses despite the challenges, despite the issues that circumnavigate or nakapaikot sa healthcare system natin. Nakita ko how PNA was able to bring us closer. How it worked hand in hand with other nursing organizations to ensure that we are being molded as one, because it's all about our collective effort. Hindi lang PNA alone, but ini-encourage that we work as one to ensure that we move forward with our advocacies. And I appreciate that in our country, Philippines right now, we are on the process of solidifying, merging, and we are trying to get rid of boundaries, of separation between and among nursing organization. And this is a good sign already that we should be happy and we should be grateful for, because we are breaking boundaries. And our contribution here is to join these specific organizations. Kung hindi ko man na-mention, join an organization and take part. Hindi yung we keep on asking ourselves, reklamo tayo ng reklamo, but then we do not contribute to our organizations. Third, give nurse-related books as gifts to non-nurses. While I was preparing this, I was smiling kasi sabi ko, nako, parang ito ata yung isa sa mga bagay na hindi ko pa ginagawa or nagawa, I mean. So why not nga naman, no? That we give nurse-related books or reading materials to non-nurses. Wag naman siguro na bigyan mo siya ng medical surgical agad-agad, no? Bata pa, bigyan mo ng medical surgical. It has to be appropriate also. So rather than being preoccupied of thinking ano bang ibibigay mo sa friend mo, sa colleague mo, or sa people sa community mo outside the nursing profession, why not give him books to read? Because it's hard for us nowadays to spend longer time sitting with that person or talking or conversing with that person, because things now ay talagang fast-paced. And if we could not allocate or spend our time into it, why not give him something that he or she could read during her free time or leisure time? Fourth is related to number 3. Spread the word about nursing work and contributions. And it says here, when you give something, it has to be age appropriate. So dapat balance siya, no? We do not give something to a child that is not relevant to his or her mental capacity or understanding. And by premise, if we want to give something to a 9 or 11-year-old, it's about interactive games for less than 9 years old, mga coloring papers, sheets, or telling stories for 12 to 14 kasi nasa teenage phase yan sila. Tell them that, you know what, nursing is a cool profession and it's exciting. And for 15 to 24, point out to them, parang medyo medyo solid ground na yung sinishare nating information to them. And we're trying to make them understand na on the nitty-gritty of what nurses do, the challenges that nurses would face, and the rewards or the impact that nursing profession could do in the society. Number 5, this was discussed yesterday by Sir Melbert. We have to participate in political campaigns and legislative efforts related to healthcare. Yes, it's true. One of the reasons why we tend to become silent because we want to sound apolitical. Tama yan, naririnig natin yan. Apolitical. But when we try to reach out to the people in position or in authority, or in Congress, for example, House of Representatives, hindi ibig sabihin nun that we are allowing ourselves to be eaten by the bad practices na andyan sa mga baggages ng mind natin. Sometimes it's the process of how we internalize things. We need the support of these people to push forward the reforms that we aspire for our nursing profession. And this slide is something that I want to make everybody understand. Do not tag it as something that is, naku, nag-aalaw na naman tayo na papasok yung ganitong element, politics na naman yan. No. Because the things that we're doing right now is we are trying to consolidate our efforts. And if we do not reach out to a specific person that would help us, our intentions must be clear. And if something happens along the way, beyond our control, what matters is our own intention as a professional body or organization that thinks about the welfare of nursing as a whole in the country. And it will not kill us if we tap persons, organizations, or agencies to support our causa. And even I myself, I have seen how relevant and how important it is to go outside of the box. Sometimes kailangan nating i-challenge yung mental models natin eh. One of the major things that delimit us from from venturing on not the usual thing is mental models din natin, yung mga fears natin, yung mga biases natin. And when we talk about the welfare of Filipino nurses, dapat porsigido tayo, dapat confident tayo, and we will explore all the good and the positive means. Please take note, the good and the positive means on how we're going to generate support more than or apart from the organizations, professional nursing organizations alone. Dapat ine-explore natin yan. Third, next is seek donations and scholarship funds. Yes, wala namang masama if we tap NGOs or charity organizations to support that, because they would see and they would feel na, ang ganda naman ng nursing profession sa Pilipinas. They're trying to find means and ways to further support nursing education or nursing scholarship, nursing research, and so on and so forth. So nakikita nila, we tap to DOST, we tap to funding agencies or bodies, like for example in research, and walang masama doon. Because if we sometimes tend not to be self-sustaining in terms of the financial aspect, by principle, what we're going to do is to expand our abilities, expand with our connections, and tap agencies. Strategy iyan, hindi yan masama. If we reach out to organizations or agencies to provide support. And two birds in one stone yan. We expand to seek for help and support, and at the same time, nakikita nila that our image is something that is relevant because we're working towards sustainability, protecting and safeguarding the future and the next generations to come. 7 and 8, this was mentioned by our speakers also. Serve on community and organization boards and write a letter to the editor. Writing a letter, pag may nabasahan kayo sa mga, if you have come across in one editorial note or article, wag sabihin na ito na naman, pinag-uusapan na naman kami, hindi naman ito tama. We need to do something. Send an email, write a letter to the editor. Hello, ma'am, sir, my name is ganito. I am a nurse. I am quite uncomfortable with the things that you have written. By the way, I am working in a specific area of specialization in nursing, and I would like to share the realities that have been happening on the nursing profession. Then, kumbaga nagsulat ka lang, but then you corrected a fallacy or a not so true information. And at the same time, iisipin ng isang journalist na, ay, maganda ito, linkage ito, and I appreciate the efforts of this nurse kasi nag-reach out siya. Meaning, he or she is actively involved in upholding the image of nurses. Writing of letter lang yan, email lang yan. But then it says a lot, it speaks a lot. And serving in community or organization boards, hindi lang sa nursing organizations or associations natin, even those in your communities na non-nursing. Take part, be a member. Hindi kailangan na dapat members of the board ka kaagad or part of the board of trustees. Kahit members man lang. And in your own simple way, you would be able to show to them that, ay, iba pala talaga yung nurses, no? May kakayahan pala silang maging managers and at the same time leaders who have the ability to do the influencing behaviors. And that's what we should do. Number 9, use our talent. And I appreciate the efforts.
I think that, all of us are experiencing exhaustion.
I can hear someone is not being muted. Okay, thank you. Number 9, use our talent. I appreciate the PNA for the poster making contest. You know what? Nursing is science, and at the same time, it is an art. And napakaganda yung activity na to. More than if now, tingnan niyo yung mga kamay ninyo, and you talk to yourself, saan na ba umabot yung kamay natin? What are the tasks or accomplishments na ginawa ng mga hands natin? Nakapag-care na tayo ng patients, nakapag-comfort na tayo ng mga may karamdaman, and so on and so forth. And then when we think about our talent, how about the art into that? Aside from the art of doing the nursing care, may other art pa na form na pwede natin gawin. And just like this one, as gleaned on this slide presentation, may mga talents tayo na pwede natin gawin as professional nurses. And when we do this, people would see, ay, naku, talented pala talaga yung mga nurses. Hindi lang sila caring hands. They're also artistic and talented. and we have to engage ourselves on these specific activities, kahit photoshoot contest pa yan, poster making contest, essay writing contest, that's talent. And when it's called a talent, it has to be shared more than ourselves. It has to go outside externally to be appreciated. And at the same time, when you bring your name with it and your profession with it as a registered nurse, you are improving and contributing to enhancing our image in nursing. And lastly, be a role model everywhere we go. And that's Florence Nightingale. Be a role model. This is such a big word that we could take a look into. But if we want to multiply ourselves, we have to make sure that the source of multiplication is something that is worth the emulation. Be role models. I'm nearing to the end of my presentation. Perhaps in 5 or 10 minutes, I would be ending my presentation. Now, the question here now is, how are we going to promote nursing's image in our organization? Simple lang, walk the talk or behave how you want to be perceived. Are you engaged in gossiping, pulling down or putting down others, questioning without contributing to finding solutions and answers, disrespecting others? One best example would also be during meetings or a gathering, a boardroom meeting, for example. Yung tipong gustong-gusto mo nang mag-burst out dahil galit na galit ka na, but then take a deep breath, relax, compose yourself, internalize, listen, makinig tayo, then express. Hindi yung dahil gusto mo lang sumigaw, gusto mo lang magwala, basta-basta na lang, you have to do it. Still, this is a difficult thing to do, but this is also one of the best examples na pwede nating tingnan when we are manifesting professional behavior. Meetings pa lang yan. How much more if we are going public, if we are speaking publicly, and we suddenly could not control our emotions and our mouth, the words that are coming from our mouth, makakasira tayo ng ating profession. And here are other techniques to improve the nursing's image. Allow me to read this. You pay attention to introducing yourself. We have discussed this a while ago. Be grateful to reinforce what nurses do. Dress code. We have institutional dress code, but the premise there is we wear what we wear as nursing professionals with dignity and respect, because that's how we carry ourselves when we face our patients and other members of the society. Respect each other, understanding the business of healthcare, use of evidence-based practice. Again, evidence-based practice. Talk about your work with family, members, friends, and members of the community. Make friends with organizations, media relations. Huwag matakot makipag-tap with media or marketing or information relations sa mga community ninyo. It's one way of making a connection na through media, we could run into someone or somebody or an organization that would provide us a platform to be heard if you want to say something good, and if you want to make a rebuttal or an appeal or a stronger message that would unify and would correct the image of nursing. We need to do this. Build a directory of nurse experts for media relations department. Advocate for link for nursing on your organization's homepage. So visit ninyo yung mga websites ninyo if you do have that. And if walang link for nursing, kailangan gawa ng paraan para magkaroon link. I actually just visited our website and I admit, kailangan kong hanapin yung link doon, and I have to do this the soonest possible time while we are revamping our website here in the workplace, in where I'm working right now, na kailangan magkaroon ng link ng nursing organization dyan na nakalink sa PNA, nakalink sa ANSAP, and so on and so forth. Hindi lang yan because we want to establish link na makikita lang sa website nyo na connected tayo. It's, take note, the one that visits the website ay hindi lang tayo mga nurses or healthcare workers. The public is expected to visit the website. And pag nakita nila doon na yung hospital mo ay nagkakaroon ng link sa mga nursing organizations, ay, maganda yung hospital na to because nakikita ko somehow that they are giving values to nursing organizations in the country. More so, pag galing siya sa mga countries na pinopromote yung pag-link ng hospitals website to the nursing organization's website. Makikita at makikita nila yan. And the voices ng mga expats natin ay ang bilis niyan makapag-influence because they have the confidence and the power to communicate the things that they have observed. Next would be, do not forget students and novices. Galing din tayo dyan. Write a letter, participate in career days and shadowing experiences, and encourage the public to use advanced practice nurses. And recognize achievement. Ano ba naman yung i-acknowledge mo, yung kasama mo? You coach, you mentor. This was mentioned a while ago by Ma'am Jerial, Dr. Jerial, about the coaching and the mentoring aspect as part of our roles as leaders. We have to make sure to put nurse representatives on key committees. Dapat may representation yan. Pag walang nurses, na-mention ito yesterday ni Dr. Bonmeo, it's at suicide if you create an organization or a structure within the hospital, for example, na walang representation ng isang nurse. How are we going to represent ourselves on the purview or perspective of nursing if we do not have someone who would be there to represent? Make sure articles or nurses appear in General Hospital newsletters if you have one. Work with your staff. Review recruitment material to ensure the tone of profession and implement shared governance. Also, help our organization to obtain magnet status. How I wish. But who knows, di ba? This is not impossible. If we aspire to be a magnet status, then gawan at gawan natin ng paraan dahil kaya natin yan. There are a lot of ways, consultants, key persons, and organizations that we could tap with if we want to work on with magnet status. Market it to the community and live up to its criteria. Provide media for training for key nurses. Promote ways for community to interact with nurses. Implement evidence-based practices. So as you can see, paulit-ulit sa evidence-based practices because this is the image that we want to project. Nursing as a profession that utilizes evidence-based practices. Nursing not as a borrowed discipline. Nursing not as a borrowed profession, but nursing in its entity that utilizes evidence-based practices. Make sure nurses know that you have zero tolerance to peer-to-peer lateral bullying or vertical leader to subordinate, mga social issues ito, and encourage nurses at all levels to increase education and achieve advanced practice degrees. And it's up to us, it's up to you. In today's workplace that is diverse, our actions and motives are constantly under scrutiny. We have to manage our own professional image before others would do it for us. As Harvard Business School professor Laura Roberts says, professional image is a set of qualities and characteristics that represent our perceptions of competence and character as judged by our key constituents. And then we have to work to gain these skills because we are the ones who hold the power to create a positive image. And I think this ends my presentation. Madamo gid nga salamat. Thank you so much for this opportunity to speak and to be heard. And to allow my voice to be heard. Maraming salamat again. And mahal ko kayong lahat, mga fellow nurses. Thank you.
And thank you very much, Sir Jake Sapulno, for that very empowering discussion. And thank you for sharing a lot of frameworks and actions where nurses can take, or nurses can take to improve the public and personal image of nursing. Once again, virtual applause, please, for Mr. Joaquin Sapul for that very empowering talk. And with that, we would like to award a certificate of appreciation to our fifth plenary speaker, Sir Jake E. Sapul. And the certificate reads, A certificate of appreciation is awarded to Joaquin T. Sapol Jr. for his valuable involvement as plenary speaker on the topic reflecting a positive image for nursing during the 2021 PNA Region 6 Summer Conference with the theme Nurses, a Voice to Lead, a Vision for Future Healthcare. Once again, thank you very much, Sir Jake. And we
Thank you
now
very much.
proceed with our interactive discussion. There are a lot of questions here posted by our participants, especially those who sent their questions via our Q&A box. I hope Dr. Nerissa Gerial is still here with us, as well as Honorable Merly Salvani, and of course, our plenary speaker, the fifth plenary speaker, Sir Jake, to answer the questions. Okay, to start, Dr. Jerial, you have the first question here. Before the question, thank you very much for the comprehensive and informative lecture, Ma'am Neris. As a leader, there are times when the management decisions are not agreeable to the majority of the staff. How will a good leader manage to make them understand the administrative decision? This came from an anonymous participant. Dr. Jerial?
Well, to answer that question, I know that not all staff will agree with the decisions of the management, but as a leader, it is our role to make this staff understand the reasons why the management arrived at a certain decision. Well, most of the staff who disagree are those staff who lack knowledge on the issue. Because based on my experience, if you will explain it to them properly and thoroughly, at the end of the day, they will also follow. So I just want to tell you that as a member of the executive committee, the management will not come up with a plan that will harm the employees and the patients. So as leaders and as staff, we should support and give our share to achieve the goals of our respective hospitals. Thank you.
Okay, thank you very much, Dr. Jerial. Indeed, nurse leaders should take the necessary approach to assert themselves and, of course, stimulate and steer the organization towards achieving its goals. Thank you very much once again, Dr. Jerial. The following questions and the next questions, of course, are directed to Honorable Salvani. There are a lot of questions here regarding CPD. And to start, the first question here came from an anonymous participant. Hi, I would like to ask about the professional identification card renewal. I renewed my PIC last year and I needed 15 CPD units for the next renewal. However, I am preparing work abroad within this year. My question is still, do I need to complete the 15 CPD units for my next renewal, since hopefully I'll be working as an OFW? My next renewal will be in 2023. Dr. Salvani? Again, this question is for Honorable Merly Salvani.
Okay, hello. Okay, if you are an OFW and the transition period is still in effect until 2023, there's no need for you anymore, okay, to be required for 15 CPD units. Okay, but hopefully by the time, in 2023, okay, it will be a new thing for us in terms of CPD requirements. Okay, as I've told you earlier, okay, the transition period of PRC for 15 units is just temporary, okay? And time will come, it will be amended sooner, that it will no longer be required as a requirement for renewal of the professional identification card of any professional. Okay, so that's my answer. Okay, in other words, if you're an OFW and the transition period is still in, okay, there is no need for you to be required to have that 15 CPD units. Okay, thank
Okay,
you.
Thank you very much, Dr. Merle. Actually, I think there are more than 10 more questions now on board here for you. Here is a related
Okay.
question. The second question here, Dr. Salvani, is that how many years is the validity of CPD certificates? This question came from Sherry Ann Silivio. Doc Merle?
Okay, at the moment, there's no more. There's no more grace period for the validity of the CPD program that you have attended. Okay, before we used to require up to 3 years, but now there's no more. No, there's no more limit. Because as I've said, time will come. You have to accumulate those. All the CPD units will be accumulated, in which it will be, the credit unit will be transferred to career progression and specialization. Okay,
Okay, thank you
meaning
very
gone are
much,
the
Doc
days
Merle.
before, gone
Before
are
we
the days
proceed with the other
before, that
questions
we were
concerning
strict.
here is another question.
Okay.
But this question is addressed to Sir Jake Sapul. Sir Jake, here is a question coming from an anonymous attendee. Sir Jake, how will you recommend students to pursue nursing as they know nursing professionals earned low salary and nurse-patient ratio in hospital settings? How can you answer students? Nursing course is too expensive, but they will earn low salary in the future. Sir Jake?
Yes, thank you, Jofred. To the anonymous attendee, for sure you are a colleague. Thank you for this question. No? Allow me to answer you sa ganitong style. Last week, I talked to 6 or 7 students, mga taong nakikilala or nami-meet ko lang in the community. And I was trying to ask them, if given a chance to choose for a profession later on, what are you going to choose? Out of the 6, 4 answered they want to venture into nursing, and 2 said any health-related courses. I was trying to ask the first 4, what opted you to take up nursing? And they said, we were able to see kung ano yung role ng nursing sa nangyayari ngayon sa Philippines and sa buong mundo. And sabi ko, oh, this is a life-changing response, because all the while, I thought that the Gen Z or the younger generation would respond to me in such a way that I was not actually expecting sana. But they responded in such a way that gusto naming maging nurse because gusto naming gawin ang mga bagay na ginagawa ninyong mga nurses ngayon. While the other 2, sabi ko sa kanila, kayo naman, inhiligay nun, no? Hindi ninyo gusto mag-nurse. Or in Tagalog, bakit ayaw ninyong maging nurse? Sabi nila is, they want to venture on other health-related industry, but it's still health. Now, if in trying to respond to the question of our colleague here, my answer would be, we have to be honest. We have to be honest in showing to them and letting them know the challenges that we are facing in the nursing profession. Hindi pwedeng itago yan. Hindi pwedeng sabihin na, ay, hindi yan totoo, ay, ano lang yan, hearsay lang yan, ay, chismis lang yan. No. Be transparent. Kung sinabi niya na maliit ang sweldo, sabihin, yes, it is. Pag sinabi niya na yung nurse-patient ratio ay sa ibang hospital, kuya, naririnig namin na ganito ang nurse-patient ratio, acknowledge that, because these things are actually happening. But do not stop on that level na you will just allow him or her to say his or her piece without guiding him or providing directions as to how you're going to meet halfway. Then you could tell the person or to that student na ano kayang pwede mong gawin to help us sa challenges na ito. Then you will tend to appreciate that they have ideas kung paano nila tayo tutulungan, rather than taking on the downsides, on the issues that revolve around our profession nowadays. And that's why every time I am tasked with this kind of or faced with this kind of scenario, I do not sugarcoat it. I always acknowledge the reality. I always acknowledge the fact that these challenges are happening around us. But at the same time, I end by providing recommendations, solutions, or getting their own insights as to how we could help one another in order to reform and to move forward in safeguarding our organization or our profession. Like for example, alam natin that the government and at the same time our nursing organizations are working hand in hand for this. Hindi natin dapat stop ang self natin to tell this young person na nagtatanong kung ano yung gusto niya maging later on by trying to make him unaware of these things. Dapat i-lay down that on the side of the nursing organization and at the same time of the associations and the government, here are the things that are being done. Now, the challenge here is timeline. Ito yung parating sinasabi ng mga colleagues natin na who tend to become restless and at the same time medyo parang nababagot na, and I perfectly understand. But then let's go back to the principle that regardless if it's a small win, a small victory, or a working towards this victory in the coming years or months or season pa no na inaantay natin, still we have to appreciate our efforts rather than having no efforts at all. So siguro I want to address this question also in such a way that given the challenges that we are facing right now, ayaw ko pa ring iwala or tanggalin yung element of hope. I acknowledge that we have issues in the nursing profession, but I want also to make everyone understand that there are things and interventions being done. Kung time man lang yung issue, let's pray and let's continue to hope and offer our support in such a way that we could contribute kung paano mapabilis, kung paano ma-strengthen yung pagbigay ng mga solutions and responses and answers to these various and diverse issues and concerns that revolve around our profession. And in line to the next question about nursing course that is too expensive, I think this is an institutional prerogative, but I think on the end of the nursing organizations and at the same time the body that represents the nursing in the country, there must be ways on how we're going to take a look on this alongside with the government in ensuring that we have nurses who would be students who would be able to access, di ba, meron nga tayong universal healthcare, why not universal education for nursing? It can be an outside of the box thinking na kung kaya sa universal healthcare na access to health, how about access to education? And one of which would be that of nursing education that would offer support and would try to address and provide answers to the diverse and varying prices of nursing education in the country. So siguro I appreciate the question because you provided a very realistic picture kung ano yung nangyayari talaga ngayon. And I will not say that these questions are something na parang hindi pwedeng pansinin because you are expressing yourself on the context of what we see around us and at the same time what we experience around us. And I think I hope I answered your questions. May ginagawa tayo and mas marami pa tayong gagawin if you who raised this question would join us in providing solutions in the coming issues and concerns that face our profession.
Thank you very much, Sir Jake. Indeed, the question is very important. Okay, so here's another question, and I believe this question is addressed to Dr. Jerial. Dr. Jerial, the question is, how can nurses, or what can nurses do, especially those who are under managers or supervisors who have difficulty in managing their staff, who are not supportive, who are not cooperative, and some of them won't even do the responsibility and does not know even some of the basic procedures in the workplace. Doc Jerial?
Well, for me, as a leader, that is a big challenge. if your staff are uncooperative. The best thing to do is to know where they're coming from. So let them, just let them verbalize their concerns and talk about it. As I've said a while ago in my lecture, you as a leader should communicate properly and openly. You should involve your staff in addressing the issues and concern. Actually, this can be an opportunity to assess gaps in the processes or in the system and arrive to a resolution that will benefit the organization and the staff as well. Thank you.
Okay, thank you very much, Dr. Jerial. And I can see that several of our participants are raising their hands again. No? For your questions, kindly type it in the Q&A box now for us to read the question. But we're down to the last two questions. We are over time for today. And these two last questions are addressed to Honorable Merly Salvani. Ma'am Merly, the question: I'm really grateful, Ma'am Merly, to your very useful and informative discussion. Most of the free webinars organized by Delex Pharma are self-directed. Belonging to a golden age, I am not that techie. How can I apply for self-directed or lifelong learning? My appointment date, I believe this is for renewal, will be on October. Thank you very much and happy Nurses Month. Doc Merly, please go ahead.
Ma'am Merl, you are muted, Ma'am Merl.
Okay, sorry. Okay, so all you have to do to apply all the SDLs that you have, apply them through our CPDAS online system, because we do not accept any more applications manually, but through the CPDAS online system. So once you apply those with the CPDAS, it will be transferred to the Nursing CPD Council. So we will evaluate, we will accredit, and then we will push it again, post it again to our CPDAS. How many units were you accredited with that SDL? Okay.
Thank you very much, Doc Merly. A follow-up question and the last question. Okay, what is the basis of the CPD Council in giving the required credit units to seminars or webinars under self-directed learning? Thank you. This question came from Anthony Altarejos.
Okay. What's the question again, Joe Fred? Okay, could you please repeat the question again?
Yes, Doc Merly. Again, what is the basis of the CPD Council in giving the required credit units to seminars or webinars under self-directed learning? Again, the basis of the
Okay,
CPD
all right.
Council in giving the
For
required units.
webinars, okay, for webinars or seminars that you will apply for SDL, all you have to submit is the certificate of your participation to that particular webinar or seminar, plus the program of that webinar or seminar. Okay, those are the only two that you will comply to be able to get the prescribed SDL credit units.
Okay, thank you very much, Doc Merly. Doc Merly, I know that
Yes.
you'll be celebrating your birthday tomorrow. So on behalf of the organizing committee from PNA and PICA, from PNA Region 6 Council, advance happy birthday, Doc Merly.
Thank you so much, my dear PNA Region 6, and to all my fellow Ilonggo nurses and all other fellow nurses across the country and across the globe. Thank you so much to this opportunity. What a great celebration for my birthday. Thank you.
Okay, thank you very much, Doc Merly. Did you a gift now to the nursing profession? Okay?
Yes.
So ladies and gentlemen, I apologize that we cannot accommodate all of your questions, but we have to wrap up things. We are already past 12 o'clock. And we had a fruitful and wonderful day for the second day of the summer conference of PNA Region 6. We discussed in session 3 effective nurse leadership in times of crisis. We had Dr. Nerissa M. Jerial. We also had Honorable Merly L. Salvani discussing session 4, investing in a safe and effective workplace, continuing professional development for nurses in the Philippines. And session 5, we had Sir Jake Sapul discussing reflecting a positive image for nursing. And we would like to invite everybody that next week, the Philippine Nurses Association National will be holding also a summer conference. So we would like to invite all nurses. The registration is free. Others are asking for free webinars wherein they can use in renewing their professional identification card. So again, everybody is invited to join us in the PNA National Summer Conference. And here are some announcements coming from PNA Iloilo. Last year, in spite of the COVID-19 pandemic, the PNA Region 6 through PNA Iloilo, headed by Dr. Grace Bello de la Riarte, conducted 3 CPD activities or 3 CPD accredited activities virtually through Zoom, provided for free to all nurses. The same is true here in PNA Antique. Yearly, we are providing free CPD units for our nurses. Actually, this coming June, a CPD activity on mental health, already approved, will be conducted for free for nurses, member nurses here in the province of Antique. And later we will arrange if we can also invite other nurses outside of Antique. So again, thank you very much for your participation, active participation in the first and second day of PNA Region 6 Summer Conference 2021. And to formally cap this event, let us listen to the closing message of the President of the Philippine Nurse Association Antique Chapter, Mr. Aris Kendall R. Bungabong. Sir Aris, please take it away.
Good afternoon to all our nurses who attended our two-day conference. Now, finally, we have come to the end. So in behalf of the PNA Region 6 Council, the presidents of the 5 accredited chapters of PNA in Western Visayas, with Dr. Lea Alayon as our regional governor, I would like to extend our gratitude to our keynote and session speakers for accepting our invitation and for sharing your expertise, insights and experiences to all our participants. Also to our nurse leaders and PNA national officers for your support and presence, and to all the participants for the active participation. We hope that this conference with the theme Nurses, a Voice to Lead, a Vision for Future Healthcare, you're able to obtain insights and learn valuable lessons from our esteemed speakers, and we all can contribute in the attainment of the vision of the Philippine Nursing Roadmap 2030, the Filipino nurses, the best for the Filipino, and the choice of the world. Again, durugid nga salamat, and mabuhay ang mga Pilipinong nurse.
Thank you very much, Sir Aris, and mabuhay ang Pilipinong nurse. A lot are asking how can we get our certificates, ladies and gentlemen. For those who are registered and are joining us here via Zoom webinar, kindly check your email for the evaluation link. Again, PNA Antique Secretariat are checking submission of evaluation form. So please do not share our evaluation form, the link for the evaluation form, because we are comparing the attendance. The official list forwarded to the Professional Regulatory Commission is that coming from PNA Antique, those who are registered to attend this conference. So once again, kindly check your emails for the evaluation link. And thank you very much for your active participation and your support to the Philippine Nurses Association Incorporated. Thank you very much, everyone. Hope to see you again in the future. Keep safe and may God bless us all. Thank you and good day. And before we end this meeting, we would like to request our panelists to kindly open their videos, their cameras for a photo opportunity. I can already see Dr. Merly Salvani. Again, Dr. Merly, advance happy birthday. I hope we can join you in your birthday celebration. Sir Jake is also here. Dr.
Merly,
Jerry
advance happy birthday.
Happy birthday, Dr. Merly.
Dr. Remy, our friend.
Happy birthday, Ma'am Merly.
2 or 3 years ago. Dr. Remy, thank you for joining us. Kindly open your cameras, everyone, especially our panelists, for this webinar. For
Thank you. A pleasure. Thanks for the invitation.
Thank
you, Ma'am Remy.
Hi. Long time no see. Happy birthday, Governor and BON Merl.
Okay, so everybody, let's have our photo up. So please, your best smiles. Ready? Okay, on my count. Ready? 1, 2, 3, smile.
Ano yun?
Okay, one more. Ready?
Smile.
1, 2, 3, and smile. Okay, so thank you very much again to our
Thank you very
speakers, Sir
much.
Jake,
Very
Dr.
good,
Juriel,
thank
Dr.
you,
Marie, Ma'am Leia, thank you very much.
Sherwin, hello.
Happy birthday,
Jake,
Ma'am
hello.
Merly.
Dr. Serwin.
Ma'am Ruby.
Ma'am Remy. Dr. Remy.
Doc Grace, hello.
Thank you, Leia.
Ma'am Nerissa, salamat gid.
Salamat po. Dr. Merly, thank you sa mga tulong mo sa amin dito sa NKTI. Naka-mute kayo, naka-mute.
Okay,
More
thank you very
CPD,
much,
ma'am.
everyone.
More CPD, Ma'am Nerisse. More CPD, please.
Happy birthday.
Advance happy birthday, Ma'am
Thank
Merly.
you. Thank you, Ma'am Remy. Thank you.
Stay safe,
Thank
everyone.
you.
Congratulations sa ating lahat, sa inyong lahat, PNA Region 6, and then Antique Chapter. Congratulations. Ang galing.
Yes, you did it very well. Well done.
Well,
Okay. Bye.